So you have studied Ayurvedic medicine and these years take a major part of your life. Once you become a doctor, you are committed to healing. And to be a great healer, learning has to become a never-ending pursuit in your life. So doctor, what are you doing to continue this learning?
A very warm welcome to all the doctors, students and practitioners for this Pachana and Rasayana.
Learning experience for everybody, even for me also, isn't it? So there is no end for learning. So that's what actually I believe.
Today's subject we are given is psoriasis.
Clinical dermatology.
If you use Vamana on yourself first, then you will believe that it will help.
Spending few hours with a scholar is equivalent to months of time spent reading books. In the name of AACHAARA Rasayanam, we are bringing excellent minds on Ayurveda with rich expertise in clinical practice. The purpose of this initiative is to guide and uplift the confidence and clinical expertise of every Vaidya. There is a saying, if you cannot be a king, the next best thing is to become a healer, because you are changing people's life, and that is the power of a Vaidya. AACHAARA Rasayanam is an Ayurvedic practitioners only CME program initiated by Sitaram Ayurveda's 100th year celebration through Sitaram Research Foundation. Sitaram started its healing journey in the year of 1921. Being a pioneer in Ayurveda, Sitaram extends the healing powers through a state-of-art GMP certified manufacturing plant, government approved R&D laboratory, super specialty Ayurveda hospital, and an NABH accredited Panchakarma retreat. By attending AACHAARA Rasayanam, you will get the opportunity to get valuable insights on clinical practices, various methods and techniques prevalent in the Ayurvedic medical fraternity from the best scholars. You will be receiving the show notes, certificates, webinar recordings, and the latest updates on your email and WhatsApp. To receive latest updates and newsletters, please send a text to 89434 41881. For more details, log on to our website www.sitaramayurveda.com. AACHAARA Rasayanam. Great practitioners invest in learning.
Good morning all. Very warm welcome to all of you to AACHAARA Rasayana, a weekly CME webinar by Sitaram Ayurveda and Sitaram Research Foundation. We are conducting AACHAARA Rasayana as a part of our 100th year celebration, and today we are having the 96th episode of AACHAARA Rasayana on the topic evidence and experiential explanation of role of Ayurveda principles of Agni as the driving cause of cancer and its importance as a Onco-preventive Therapy. We all know the importance of Agni in the clinical practice, and today we are having a renowned person as a faculty, Dr. Nitin Kochar, who is a well-known clinician from Maharashtra. We are looking forward for a wonderful clinical experience sharing, sir, on behalf of Sitaram Ayurveda Research Foundation. With all the respect, inviting Dr. Nitin Kochar, sir, to our 96th episode of AACHAARA Rasayana. Welcome, sir. And today we are having our chair of the session, Dr. D. Ramanathan, sir, who is the managing trustee of Sitaram Research Foundation and managing director, Sitaram Ayurveda. With all the respect, welcome, sir. And we are having our moderator of the today's session, Dr. S.P. Srijit, sir, who is a well-known person for all of us and also like a brother for me. Welcome, sir. And also, last but not the least, the backbone of AACHAARA Rasayana, our participants who are always inspiring us to conduct more and more sessions. Welcome all the participants, and once again, welcome all, and over to Srijit sir for moderating the session. Thank you all.
Welcome all, welcome all. So we are very privileged to have Dr. Nitin sir. We all know that he is deeply involved in this work, and the topic of cancer amounts to a lot of importance, not just because it is a dreaded disease, but also it's so widespread, rampant. In fact, instead of putting cancer into one set of disease, it is a multi-system challenge any doctor would face, and anything that comes into the yapya and asadhya are invariably into cancer anyway. So the agenda we have from this webinar, long-term socio-medical agenda, is to inspire Ayurvedic doctors to get into the domain of cancer treatment, create opportunities of involving with patients, helping their quality of life, if not full cure, which is a matter of debate and so much variables are involved into it, so that we have more number of doctors who are stepping in to the aspect of cancer care, if not cancer cure. Because currently the field of cancer is heavily dominated, I would use the word dominated, and dependent on the allopathic sector, which is fine. However, uh, whatever little I would know about cancer care or cure or treatment under the guidance and training of the legendary Dr. C.P. Matthew Sir, who was 1954 MBBS and 1960 MS, and then he retired in 1986, but he still was working, and he had 37 years into the Ayush implemented in his allopathic career, and he expired last year. Most of us know him. At the age of 92, he was practicing. So he was a medico for at least 67 years and as a doctor for 62 years. So if I summarize whatever 10 years of association I had with him and 2 years of intense training from him, I have realized through his teachings is that Ayush has a great scope and a great relevance in the cancer care or cancer cure. And that's what he showed in the form of integration. And he would always say that no matter what is the disease, you have to treat the patient also. And the amount of chemotherapy that is rampant, and rightfully so on many occasions, and rightfully not so on many occasions, the amount of radiation that goes through, which is also needed on many situations, and the amount of what they call as preventive chemotherapy, if I use that word, which is what many allopaths use, and the amount of surgeries, the patient is sometimes, we would use the word, vyadhi aushadha karshitan, like, many a times it is the chikitsa karshitan situation. So this is where we have a great scope for our Ayurvedic doctors to step in. Regretfully enough, what I have understood by my feelings, or rather my not gut feelings per se, but by my direct experience with interacting with doctors of 15 different states on regular basis, is that majority of the Ayurvedic doctors, they do not think they are qualified in that sense of it, or they are confident or not enough to get into the cancer care aspect. They just conveniently leave it for the allopathy sector to deal with. The fact of the matter is, many allopathic doctors, they do confide us in person that there's a limit of how much they can do once surgery, chemo, radiation is done. The rogi deserves to be treated when the roga has been already treated or hyper treated. And this is where our core concepts of, the bala, the concepts of Agni, simple Vyadik Shamatva, and the Koshta, and multiple such things which make corrections on a person are so important. And that is precisely why nobody has to be a Shalyatantra PG to be treating a cancer patient, because that is where exactly I'm a basic principles PG, but I am involving into big time into Kuti Pravashik Rasayana, all the parasurgicals, except Shara Sutra, and also the oncology, because I profoundly believe anyone with BAMS is Ashtanga Vaidya already. So this is exactly the idea that we want to convey through this webinar and through the recordings that will be shared, and also the screenshots I'll be sharing with 2231 minus two of my phone numbers, 2229 doctors who would receive it real time now today. That yes, any graduate, BMS graduate who has a good sense of what we call as the Kaya Chikitsa line, if not Shalya fully, can definitely involve into cancer care and make life better for the patient. And by this, we create opportunities of Ayurveda in the society. We create a situation where people would feel, yes, if it is cancer, at least after post cancer chemo or post chemo or post radiation, that I must go to an Ayurvedic doctor and let me sort out my immune system, at least, if nothing else. Because longevity is in the hands of God. We all know that. We are not qualified to interfere in that. at least the quality of life, we are answerable to the society. So with this sense of medico-social understanding and plan, in the name of God, and let us start. I don't know uh, if how many of you are aware, Dr. Nitin sir has been profoundly influenced by his teachers, and I would let him start with. To all those great teachers of his, at least Dr. Gala sir, I know personally. Vaidya Sharma sir, I do not know personally, but no, we can only think, mind Charan Sparsh to these two great teachers, without whom a student cannot be, fantastically effective. I think let us start with Guru Vandan to both these great teachers, Dr. Gala sir, Vaidya Sharma sir, and Nitin sir. We are all yours. So we are more than enthusiastically waiting for your deliberations. And if you wish to have a voice rest after about an hour, Dr. Rahul would be, very much stepping in, give you a 5 minutes break, and then we will resume. And as you know, sir, maybe you have attended the webinar before. Your good friends, the very, very brilliant Dr. Hima Nanavati. She has also been here in this webinar. And of
She is excellent.
yeah,
She is at par. She is excellent.
I would agree 200%, sir. 200%. And
Yeah.
also Ashish Phatke, sir, has been here. Last
Yes.
time. Yeah. So, so what I meant is that they have been here. They have been very comfortable in the webinar. And we are absolutely like a family unit. This webinar formalities are less. And we are so family oriented. And we are so like, I usually put black dress, sir. Black is I like because black absorbs all energies. But there were more than 10-15 comments that doctor, your black is like a very, sadistic color. You better have a bright color. So in the demand
I'm
of
wearing blue. I'm
yeah,
wearing blue color.
in the demand of friendly participants, I changed to yellow color only or something bright. No, so we are so sensitive to people's wishes and requests. So it's very, very friendly this, and you won't feel at all like a official meeting. Serious webinar in a very friendly tone. So we are all yours, and please feel free to go out of the limits and not just be a webinar oriented discussion.
Yeah.
So we are all yours,
Thanks
sir.
a lot, Dr. Srijit. Yeah. Yeah. So, Dr. Srijit, rightly you have summarized everything about the cancer and the role of Ayurveda doctors, what it should be. And that's what I'm going to carry forward. Whatever you have said, the principle, I'm going to expand it. And it's indeed a challenge to speak after listening to Dr. Hima Nanavati and Dr. Ashish Padke, those who are par excellence. I will try my level best. And I hope you all will like it. The name is Evidence and Experiential Explanation of Role of Ayurveda's Principle of Agni as the driving cause of cancer and its importance as the Onco-preventive Therapy. So little lengthy name, and experiential is nothing but, what I have learned from my mistakes that you should not do. So I have corrected those mistakes and I have presented the right thing, what you can do, and you can carry forward the research. So with this, I'm first of all thankful to Sitaram Ayurveda, Dr. Rahul and Dr. Srijit, and all 278, 280 participants who are still joining. Wonderful. Okay, so let us start. Okay. So little introduction which you have already given. The journey started in 2006 when I had an opportunity to work in Tata Hospital with Dr. Manish Agarwal. He is a great orthopedic oncologist from Tata Hospital. Then he was working. Now he's in different hospital, Nanavati Hospital. So we have worked together on osteosarcoma. Thanks to Dr. Manish Agarwal, this trial of curcumin and ashwagandha was to be carried in Pittsburgh, but Dr. Manish Agarwal, who is an MS ortho oncologist, he said, turmeric and ashwagandha belongs to Ayurveda, so we will be doing this trial in India itself. So I'm indeed thankful to him. And this 2005-6 clinical trial, what happened in Tata Hospital actually changed my life, and it has given me some aim, a very important aim to work on this and to do little contribution to my level best. So before that, I was also working on KM Hospital. So Dr. Nilima Kshirsagar and Dr. Nirmala Rege, I am thankful to all these people. Now, whatever references I have taken out, the bibliography, if you see, these are all modern journals. Of course, need not to say there are many Ayurveda journals also. So best of the PubMed indexed journals I have read, and I have selected the abstracts, and I have worked on this for last almost 11 years, 15 years rather. And if you like all these things, my paper and presentation, that is all, because of the efforts of these journals. If you don't like, it is my shortcoming. So as Dr. Srijit, you rightly said, Adhyana Timira Andasya Jnananjana Shalakaya Chakshuru Nimilata Yena Tasmai Shri Guruvai Namaha. I am thankful to Dr. Ashok Vaidya, who is a pioneer of clinical pharmacology and reverse pharmacology in Ayurveda. So wonderful person. He is 90 plus and he's still practicing. Wonderful research he is doing. Dr. Manish Agarwal, Dr. Banawali, he's from Tata Hospital. Dr. Badvesa, Dean from Tata Hospital. Dr. Banawali is a director. Dr. Pankaj Chaturvedi. So right now also I'm working on some another clinical trial which will be published in 2023. Then Kshirsagar Madam, Lal Hingorani, Dr. Late Marwa sir, who is father of my colleague, Dr. Rachana Marwa. And I am indeed thankful to Dr. Syed Tahir Hussain, who taught me, who trained me in cannabis. So cannabis use in cancer. So, last 3 years, 2 years, I'm practicing on cannabis. So I'm thankful to Dr. Syed Tahir Hussain from Kerala. He trained me. I'm a certified trainer on cannabis. My Vaidya H.B. Sharma ji, who is my guide, Dr. Gordia sir, Dr. Devchand Gala sir, Dr. Milind Patil, Dr. Rakesh Sharma ji, I forgot to mention his name, Dr. Ranawat sir, Dr. Ashish Fadke, Gorodia, my friend, and Vishwajit Patade, and many more, and all my patients. So parents, my almighty teachers, I'm thankful to them. And so let us start with that. So Dr. Srijit, as rightly you said, modern medicine is being primarily focusing on treating cancer. Okay, and they are subduing somewhere to Ayurveda or herbal or alternative medicine. But conversely or contradictorily, if you see most of the potent chemotherapeutic drugs, modern chemotherapeutic drugs are derived from herbs. Like Taxiol, one of the best drugs is paclitaxel, is derived from the Taxus brevifolia. Then Vinca alkaloids, Camphethin, these are all derived from Campothera acuminata. So many herbs, we know that like chloroquine and artemether and atropine and digoxin, there are so many, according to the data, 11% of the modern drugs which are at least used in ICU are derived from the herbs. So it's a huge contribution. We must, explore whatever is written in the text, take it as a lead, find out, and that's what Dr. Ashok Vaidya and they are saying, that you find out, take it as a lead, don't neglect it, the ancient science, and move ahead. So these are the prominently used herbs which in the modern science. Unfortunately, the research was done only in the USA and other Western part from 1960 to 2002. These drugs are developed by extensive research on the herbs. So, and this is not I am saying, these are the journal, what it says, how to raise the bar, how to minimize it. Anyway, so 3,000 species out of 35,000, 3,000 species, they have reproducible anti-cancer activity. The word reproducible is very, very important. Very, very important. It is not that by chance or by fluke person is cured by that drug. There are 3,000 herbs which have confirmed reproducible activity, and this is from Journal of Plant Sciences and Agriculture Research 2017. And this is research is carried out by National Cancer Institute. So why not to think of having future plant-based chemotherapeutic molecules via reverse pharmacology, as Dr. Ashok Vaidya used to say, ashwagandha, bhallatak, cannabis, chiraita, curcumin. And Dr. Srijit and all of you will be surprised. There are lots of research is being done in the world on these herbs. Okay. And one day it will be no surprise to me if someone comes from the US or from the Europe and will claim on your Chitraka, on your, already they have taken Gudu, Tinospora and curcumin. We Indians are boasting to antagonize the Guduchi and curcumin, but Western people they are using it. Shallaki. So there are a number of drugs, which have anti-cancerous properties. So let us explore it. So this would be like, something green cancer, anti-cancer approach. So you find out the molecule extraction, take the lead from the herbs, from the text, take the extraction, okay, do the filtration, do find out whatever may of compound identification through various method, TLC, HPLC, FTR, find out what is the most active component, do some clinical, I mean to say animal model study, in vitro, in vivo, and then if you find safe, you can do the human studies. So this is how the modern science is. We must respect this. We must accept this. No doubt about it. If someone is saying that ashwagandha is useful because of the vithafirin, yes, I accept. But what I always say, just using vithafirin A or curcuminoid or plumbagin is not going to make you successful. You need not to forget, you should not forget the principle of Ayurveda. So modern research, yes, you accept, but at the same time, you do not cross the boundaries of Ayurveda principles, Ayurveda Siddhanta. They are everlasting. They are eternal. You can't think of changing it. So eternal principle, it is your shortcoming that you are not able to understand. 20 years before, when we were learning, people were laughing if you ask someone to do fasting. My guru, Dr. Devchand Gala, who taught me fasting, and I have seen the result in 90s that how the rheumatoid arthritis patient is cured. So now today science has said, yes, fasting is good, intermittent fasting, and now there is a fad to do extra fasting. So one must understand the ancient science, do not bypass the ancient principle. So my always principle, even in modern medical seminars, I say, application of this modern concept without the basis of principles of Ayurveda will be a big failure. And the name of Ayurveda will be spoiled. No, ashwagandha is not working, curcumin is not working, there are no results, but you have not used it as per the Ayurveda text. So there are going to be failures. So let us not forget, and I have tried honestly in my private practice. When I'm in hospital, KM hospital, Tata hospital, I'm trying my level best, but it needs sea change to do to imbibe them, to make them imbibe the principle of Ayurveda. So I just observe, I accept whatever I being a part of the clinical trial, and then I move ahead. But in my private practice, I honestly follow whatever Ayurveda principles are there, and I'm getting good results of it. Now, the most important question, Dr. Shivdit, as you said, what we should do? Can Ayurveda doctor prescribe Ayurveda medicine to cancer patients? So this is a WHO strategy for 2014-13. Nobody is above the WHO. If somebody questions your ability, these are the WHO facts. So WHO itself said that every country must harness the potential and contribution of traditional medicine for the wellness and people-centered healthcare. Most important. People-centered healthcare is the most important. Absence of disease is not health. Person should be healthy. Okay. So that is what Ayurveda Swasthya Swasthya Rakshanam. So one must integrate traditional medicine and practitioners into conventional health system. Most important. Someone has done some research on ashwagandha and start prescribing it. Some non-Ayurveda doctor, and he doesn't get result, and there are some side effects. Then again, he will bombard on Ayurveda. So every clinical trial, there must be a traditional practitioner. So government is doing their job. We are trying our level best so that we can future clinical trials, we can make them changes according to the principle of Ayurveda. So traditional medicines of proven quality, safety, and efficacy contributes to the goal of ensuring all people have access to care. So these are the words of WHO former Director General Dr. Margaret Chan. So with this, I think we are capable and we are legally supported by WHO so that we can prescribe the safe medicines to cancer patient with the proper aim in our mind. Now with this, let us start with the what is a cancer like, yeah. So what are the hallmark of cancer cells? So uncontrolled growth, resistance to apoptosis. There are 6 what we call pratyatma linga. So these are the 6 pratyatma linga or stages of the cancer. Uncontrolled growth. They grow uncontrollably. You can't control them. The death is the truth. If person doesn't die, and just imagine everyone lives for 1,000 years, what will happen to Earth? Our every cell, the 350 trillion cell, they die every day, and we get rebirth every day. So but these cancer cells, they don't die. Okay, so there is a resistance to apoptosis. Apoptosis means the natural death of the abnormal cells and aged cells. Okay, then they have ability to metastatize. My heart cell will not go to the lung, or lung cell will not go to the liver. But cancer cells, they are, funny. They are tricky. They want to expand. Okay, they are like a terrorist. They want to expand everywhere. So these cells are metastatic. They will go from one organ to the other organ. Okay, and they are smart enough so that they can evade They can bypass your immune system. So they are very smart. Okay. And most important, where we have to target, that they have an ability to reprogram, metabolic reprogramming, in a way that the person healthy tissue becomes weaker, and these cancer cells, they become stronger. So that is called metabolic reprogramming, and they try to change your cellular powerhouse in such a way that body nourishes only cancer cells. And they also smart enough, they have a chemo resistance. Okay, so many patients, they come, Dr. Saab, first chemo, we were very happy, but then again, there's a relapse. Now, second chemo is not working. Third chemo is not working. What to do now? So the chemo resistance is another big headache. Okay, when you discuss with the modern people, they say, yes, these are the problem. We should be able to, 90% of the cancer patient, Dr. Shrijit and all, they don't die because of the primary tumor, but they die because of the relapse, metastasis of the disease. So Ayurveda can play important role, very important role in preventing relapse, in preventing metastasis, in helping modern medicine to work better so that chemo resistance is not there. So this is what called integrated treatment. Now let us understand what are the factors causing this hallmark so that I can identify the herb which will work on that, and then I can infuse it based on my Ayurveda principles. So overexpression of, body has got a beautiful system, balancing system. If somebody is growing more, body will kill. If somebody is not growing, body will grow. Like, if the bone grows more, osteoclast, they get activated and they will reduce the osteoblast. But excessive amount of osteoclast is going, it is going to degenerate the cartilage and bone. So that is bad. So body has got, balancing system, overexpression of certain anti-apoptotic factors, the factors which are responsible for the survival. If they are overexpressed, like heat induced factor 1, BCL2, BCLXL, you can get full form in the Google. Okay, so overexpression of these anti-apoptotic factors, suppression of the factors which are responsible to kill the abnormal cells, okay, like DRP1, BAC, cytochrome C, if they are suppressed, so overexpressing of the anti-apoptotic is increased, and there is a suppression of the factors which are going to kill. So this imbalance causes uncontrolled growth. I hope I am clear. Second thing, there are certain pathways. For example, a cell, this is a basic thing one need to understand before we start the treatment. A cell, when it is going to die, it gives birth to two identical cells, its daughter cells, what we call. So it goes under a particular fashion. So there are phases G1, S, G2, and M. There are the 4 phases. So in the G1 phase, except the nucleus part, your mitochondria, your Golgi complex, other things, they double. Then there is a rechecking. There is a checking, like a P53 molecule plays very important role. This P53. So this P53 examines that G1 phase. If everything is in order, if anything is not in order, it will stop the cell cycle. Okay, it will repair the defect. If the repair is not corrected, then it will kill that cell. That is called apoptosis. Okay, but the defect is corrected, then it will continue the next cycle to D2. So this P53 plays very important role. So once the G1 is over, then nucleic material become double. DNA become double. Again, P53 come, checks P53 and P28. It checks again that whether G1S has grown properly or not. Anything abnormality, it will kill, otherwise continue. So like this, same happen in the G2, and ultimately in the mitosis, the cell generates the 2 cells. So this is a wonderful cell cycle, and for that you require number of kinases, what we call cyclin dependent kinases. So these kinases play very important role. What happens in cancer? The P53 molecule is suppressed. So abnormal cells, they carry forward. And the cyclin dependent kinases, CDKs, there are various CDKs are there. So these CDKs, they stimulate the uncontrolled growth. So if I want to prevent the metastasis, if I want to prevent the abnormal cells growth, I need to improve P53. I need to suppress CDK activity. Similarly, mammalian target of rapamycin, mTOR. So uncontrolled activation of mTOR, again causes the growth and the spread of the disease. So I should suppress the mTOR or I should block the mTOR pathway. Then I should also be able to stimulate the death receptors activation. Okay. And I should be able to inhibit the nuclear factor kappa B inhibition. I should be able to do it. So these are the factors which are all responsible for the hallmark of the cancer cells. Fibroblast like cell migration, fibroblast like cell, they are helping cancer cell to migrate. So I should be able to block the fibroblast. Okay. And increased glycolysis, like they said, the metabolic reprogramming and upregulation of vascular endothelial growth factor. So because of the upregulation of this vascular endothelial growth factor, the cells, there is angiogenesis and the cells start leaking from the capillary to the other cell. So I should be able to block this vascular endothelial growth factor. Okay, I should be able to arrest this. I should be able to arrest this. So if this happens, I can control the hallmark of the cancer cells, and cancer will be at least relapse or metastasis will not happen. Let us see how it happens. So now this is the normal cell division. As you can see, this is the first abnormal cell, but your P53 and other molecule come into play and they kill the cancer cells. Okay, and so this cell is what called suicide or apoptosis. But if doesn't happen, then there is a second division, second mutation. Okay, third mutation and fourth mutation. Now this, so God is giving you 4 chances. There are 4 stages. Cancer doesn't become overnight. Okay, so these are when this happens, fourth mutation, the cancer starts, proliferating. So you should be able to arrest here, or at least here you should know that, yes, no, I have to arrest the cancer cells growth. Chemotherapy can kill this. Chemotherapy, radiation, surgery can remove this. But preventing this is most important thing in the treatment of cancer. And this is what onco-prevention, the treatment which is able to prevent the initiation, growth, and the spread. I repeat, initiation, growth, and spread of the cancer cells or abnormal cell is called onco-preventive treatment. So you got a chemotherapy, you got a radiotherapy, you got a surgery, you got a immunotherapy. But without onco-preventive therapy, we also call chemo-preventive therapy, the cancer treatment is not complete. And as Dr. Srijit rightly said, this is the strength of Ayurveda. Ayurveda medicine, if explored properly, as I said in my earlier slide, can be chemotherapeutic. Okay, and also will have a role as an onco-preventive. So we all doctors put our efforts so that we can bring forward some solution for the betterment of the humankind. Okay, as our forefathers Charaka and Sushruta have said that the health for all, sarve sukhina santu, sarve santu niramayaha. So that is the goal which we have to transpire from them and have to carry forward for the next generation. So now the question comes, who is a driver? Whether this hallmark cells, who is the driver? Whether DNA mutation is a driver or someone else is a driver. So a lot of research is being done. So whether DNA mutation is the cause or DNA mutation is the outcome of something. Let us see. Now this paper, which says that DNA mutation may not be the cause of cancer. And if you can see whatever I have done in the blue marking, the evolving targeted therapy, the latest is targeted therapy suffers resistance. There is a resistance, and which suggests that DNA mutation considered as a drivers may not have role in the tumor initiation. The present work discussed the role of DNA mutation as drivers and the passenger in cancer initiation and development. So even why targeted therapy should fail? I know this is the cancer cell, this is the DNA mutation, I will target the DNA, but this doesn't happen. Hardly 20-30% success rate is there. So even DNA mutation, which is supposed to be the targeted treatment for the DNA, is not helping. So there has to be something else which is making further faulty DNA. So what is that? So even cancer susceptibility variant, some family is having cancer. We see many cancer, they are having, hereditary history. So even variant present in the family does not necessarily mean that everyone who inherits variant will develop the cancer. This is what the fact sheet from National Institute of Health, National Cancer Institute, not my words. So, and the latest research, this is 2017, just pre-COVID era, all these papers were published. Another paper, okay, 2013 ka paper hai, cancer as a metabolic disease, implication for north. So they found out that genomic instability, yes, there is a genomic instability, I'm not denying, there is a genomic instability which leads to proliferation, but this genomic instability observed in tumor cells and other recognized hallmark of the cancer are considered as a downstream epiphenomena of the initial disturbance of the cellular energy metabolism. So if the energy metabolism is affected, that will affect the DNA. So DNA mutation is not the driver. I am treating the passenger. So I am treating a wrong person. So I will not get results. So I should concentrate treatment on the driver, which is the driving force and which is the cellular energy metabolism factors which are responsible for that. 100% genomic instability later on becomes very strong. So we have to integrate both. Unless you integrate the treatment for genomic instability along with correcting of your cellular metabolism, cancer treatment will not be successful. So this is very important message in this slide. Okay. This is from 2009 or 10 journal. So cause of cancer, if you see, 95% is environmental factors, which includes, the diet. Surprisingly, 35% cause is diet in your environmental factors. Okay. Tobacco equal 30%. So faulty diet is equal to chewing 30% of the tobacco. The infectious diseases, obesity, which is increasing in India like anything. And the latest reports say that obesity is not 20%, but 30% responsible cause for the cancer. Alcohol, people, accuse and abuse alcohol, but it is hardly 4 to 6%. Please, Dr. Shijit, but I don't want to give the message that start drinking from tomorrow. Okay. So 4 to 6% alcohol, and there are other causes like infection or some other things, which can cause cancer. So, and genes are only 5 to 10%, actual genetic mutation. So all these factors, they call somatic mutation. There is a mutation in the genes, yes, but that is not inherited from the genes. Only 15% of the actual defect in the gene. Rest is all because of this factor. So this is called somatic mutation, and this happens because of this, the mitochondria, your cellular powerhouse. So all these environmental factors first damage your cellular powerhouse, which is responsible for the bioenergy, okay, cellular metabolism, homeostasis for that, and this mitochondria then damages your gene. So this is a somatic mutation, not the genetic mutation. Okay. Now, what is mitochondria like? So the mitochondria, if mitochondria is healthy, the person is healthy. Okay, if mitochondria die, the cell die. So when mitochondria feels that I'm not able to work, I'm producing more of free radicals, I'm not producing the substrate, I'm not producing the energy, this mitochondria releases cytochrome C, a death signal, internal death signal, and that cell slowly dies. So mitochondria is responsible for the health. Mitochondria is responsible for the cellular homeostasis, tissue homeostasis, and mitochondria is responsible for the death of the tissue. So mitochondria is the most important. And in a cell, there is only one nucleus, but there are 200 to 400 mitochondria are there. So the probability of getting infected or inflicted by wrong diet, by tobacco, by alcohol, by other factors, pollution, mitochondria, 400 mitochondria, they will be inflicted first, rather the nucleus, which is tightly seated inside the restricted entry, double all coated, very difficult to access to your DNA. So all these factors, it's like they cannot bypass the mitochondria and other membrane, just directly go to the DNA. So these environmental factors will first affect the mitochondria, and the mitochondria, which has got access to the nucleus. Because, mitochondria is a Raja. He is going to produce, he's like not a Raja, but he's a Pradhan Mantri. He's a minister, chief minister. He's a prime minister. He has got access, okay, to the nucleus, to the president, to communicate with them. See, nucleus will give order to the mitochondria. I need these many things, these many energies, okay? And the mitochondria will produce and will communicate the king. Yes, I have done this thing. So this mitochondria and the nucleus communication plays very, very important role. I will show you how. So this is what, the picture is. The healthy mitochondria is responsible for the health. Damaged mitochondria responsible for the disease, and the dead mitochondria is responsible for the death of the cell. I hope I am clear. So this is what this journal from 2016, okay, advanced drug delivery, what you can read. Partial bioenergetics dysfunction is the basis of the most complex disease. This is from American Heart Association, 2016. So dysfunctional mitochondria, oxidative phosphorylation dysfunction, okay, is responsible for cancer initiation, promotion, and metastasis, aging, responsible for your immunological diseases and inflammation, fever, all autoimmune diseases, all metabolic diseases like diabetes, obesity, thermoregulation, okay, degenerative diseases of neurological diseases, okay, anything, motor neuron disease or whatever, multiple sclerosis kind of degenerative diseases, or myasthenia gravis, autoimmune nerve diseases, cardiac diseases, even renal diseases, degenerative diseases. So these are all outcome of oxidate phosphor dysfunction of the mitochondria. DNA, mitochondria has also got DNA that can also get affected and that can cause this. But majorly mitochondria is affected by the factors which I said: wrong diet, faulty lifestyle, okay, smoking, alcohol, pollution, infection, trauma. So with this, mitochondria first get affected and then causes the consequences. So these are the mitochondria linked diseases. This is another journal. Okay. So this is the communication. Wonderful picture. So mitochondria, they are giving communication to the nucleus. Okay. So this is called retrograde communication, and nucleus is giving the communication to the mitochondria. So this is called anterograde communication. So there are proteins. If I give wrong information to my king about the health status of the community, if I say everybody is good, very is good, no problem. So king will say, okay, okay, my praja is very good. So king will be, sleeping properly. So if the wrong proteins are playing havoc in giving wrong information to the nucleus, okay, that's what happening in the cancer. I will show you how. So this is what we call communication. Nucleus, the blue line, goes to mitochondria, communicates with certain proteins, anterograde signaling. So mitochondrial DNA maintenance, very important. Gene expression as per the need of cell energy and growth. So nucleus will say, I need carbohydrate, I need fatty acid, I need nucleic acid, I need ATP, I need cell specific protein I need. Renal cell will say, I need erythropoietin, or cardiac cell say, they will say, I need troponin, so cell specific proteins are produced by that. Once the mitochondria, after consuming the food and oxygen from the lungs and the GI tract, will process in the Krebs cycle and other electron transport chain and will produce substrates, okay, and the energy required, and will tell the cell that, yes, I have produced. And as a byproduct, it also produces reactive oxygen species, that is free radicals. There are metabolic intermediates are produced. Okay. Now, dysfunctional mitochondria initiates, very important. That's why I made it dark. Dysfunctional mitochondria initiates the global changes in the gene expression. So mitochondria is giving wrong impression to the gene. So gene changes. Gene will change its expression because it has received a wrong communication from a very important person, and he is he trustworthy. Okay, so that is what is called. Secondly, reduced number of size of functioning mitochondria also triggered oncogenic process. There are certain diseases in which mitochondria, they shrink. When I eat food, the mitochondria, they fuse and they become big, so they can digest. When I'm not eating food, the mitochondria shrunk, they separate apart. They become, it's a liquid material. But there are certain diseases in which this fusion is not happening or fusion is not happening. And that can also cause the diseases. So hypoxia, antibiotics, okay. So all these factors, xenobiotics, what we call inflammation, Shotha, they all cause mitochondrial fusion. They don't allow mitochondria to grow together, okay, which is not able to produce proper energy substrate, energy. They produce abnormal substrate. I will show you how it happens in the next few slides. And this activates cytosolic calcium and calcineurin, and all these changes happen. They alter the nuclear gene expression, and there is an oncogenic transition, and this mitochondrial retrograde signaling, okay, it causes the oncogenic process. Now, what happens next? So reduced number of size, reduced electron transport chain functioning. Size is reduced, energy production is reduced, and there is a mitochondrial DNA mutation, one of the causes. Okay. So outcome will be increased free radical production, increased accumulation of oncometabolites. Non-functioning mitochondria will produce more oncometabolites, succinate, fumarate, or 2-hydroxyglutarate. There are a number of metabolites are there, which are produced by faulty mitochondria, and they give wrong signaling to the nucleus, and they inhibit the death signal. The active mitochondria or healthy mitochondria, when it is aging, it will generate death signal. But mitochondria which is faulty, it is not able to generate the death signal. So the first cause that why cell becomes immortal, the mitochondria is not functioning properly. What part of mitochondria is not functioning properly and what is functioning abnormally, that I will show you in the few next slides. So this dysfunction, abnormality, okay, will not cell to die. It will not generate the death signal. Okay. So friend, this is the normal cell. What happens? Whatever food you consume, normal cell, it enters glycolysis, pyruvate is produced, acetyl coenzyme, 2 molecules of pyruvate, acetyl coenzyme. This acetyl coenzyme is only made for mitochondria. This cannot be processed extra mitochondrial spaces. In lysosomes, everywhere, they will not be able to process. So this acetyl coenzyme enter into mitochondria, enter into Krebs cycles. From Krebs cycles, NADH or FADH are produced. They go to the electron transport chain, a 5-electron transport chain. With the help of oxygen, oxidative phosphorylation happens. So from the food you produce 40 molecule of ATP. Say 1 gram of glucose will give you 40 molecules of ATP, plus heat is generated, most important. Reactive oxygen species are generated, water and carbon dioxide. And through anabolic pathway from the food, the substrates like fatty acids, nucleic acids are produced. Okay. And they are used for the biosynthesis of the organelle. Okay. Now what happens is, in cancer, damaged mitochondria, they are producing less energy. So the ETC, electron transport chain, is not working properly. Okay, so acetyl coenzyme is processed in the Krebs cycle, and this is further sent into the cytoplasm because body needs energy. And its body is trying to find out how to break down the acetyl coenzyme and produce more energy. So in that effort, acetyl coenzyme is sent back to the cytoplasm. Okay. So there is a fatty acid synthesis. So body will produce energy, but in that process, body is now also producing excess amount of fatty acid, excess amount of nucleic acid. Okay. So there is a reduced aerobic glycolysis. Okay. Fermentation starts happening. Okay. Which produces which produces very minimum energy, but lots of lactate dehydrogenase is produced. Okay, there are increased anabolic pathways in response to low energy production. So body produces more fatty acids, more nucleic acids, more amino acids. My normal cell will produce 40 molecules, as I shown, 40 molecules of ATP and balanced amount of substrates. But this abnormal, dysfunctional mitochondria will produce less energy and more amount of substrates, more amount of fatty acids, nucleic acids, amino acids. So this excess amount of material which mitochondria has produced, okay, and less amount of energy is produced. So what it will do, this message is given to the nucleus that I have excess amount of nucleic acid, I have excess amount of free fatty acid, I have excess amount of fatty acid, amino acids. After getting this message from the mitochondria, now nucleus will say, okay, if you have got excess, I have to produce more number of cells so that I can consume the excess fatty acid, nucleic acid. Now, when I have to produce more, what I will do? I will shut down P53. So P53 will not stop the proliferation. I will improve cyclin dependent kinases so the cell proliferation happens. Cell cycle is fastened. I will stimulate mTOR so that cell proliferation happens fast. I will suppress the death receptor so that cell doesn't die. So all these hallmarks are now set in. So the nucleus is compelled to its newer metabolic state, becomes proliferative, stimulates pathways, growth receptor, kinases, and inactivates tumor suppressors and the apoptotic factors. So now this nucleus has become very aggressive. It is taking over now, and the mitochondria has given the wrong signal, and the cancer process starts. This is from this journal Cell 2016, that mitochondria support tumorigenesis, oncometabolite production, signaling oxidative stress, biogenesis, fission fusion dynamics are affected, metabolic. So all these stages, initiation, growth, survival, and metastasis, these are the stages of the cancer: initiation, growth, survival, and metastasis. They all depend on the mitochondria. Mitochondria, they are responsible for the. So in a normal in a cancer tissue, see, there are 20 cancer cells are there, but 80 are healthy cells. And it can happen other way: 80 cancer cells and 20 normal cells. So person who is having more amount of healthy mitochondria, he will respond to chemotherapy. And the one who has got less amount of healthy mitochondria, more amount of abnormal mitochondria, okay, he will not respond to chemotherapy. This is the root cause. So I have to correct mitochondria to improve the chemotherapeutic function. This is what you can discuss with your modern people. If I improve the mitochondrial function, your chemotherapy outcome will improve. The relapse and spread and metastasis will be arrested. Why not to use it? And give them these references. All these references are from the PubMed index journals. They may question you, but they may question this also, but they will think twice, because this is something from the journals, from the people those are doing research. Okay. Now, I have to. There is a saying in Marathi: "Baap dakhav nahi shraddha kar." Means show your father or do the shraddha. Usko jawab ek hi hai: ha Surya and ha Jayadrat. In the Mahabharata, okay, Lord Shri Krishna told to Arjuna, see, this is Jayadrat who killed your son, and this is son. Come on, now get and kill. So I am giving the fact. Now they did a trial. So this is the normal cell giving birth to the normal cell, abnormal cell, cancer cell giving birth to cancer cell. Now I say that nucleus is the driver, causes cancer. So I will remove the nucleus, nucleic material, cancerous material from the cancer cell, okay, and I put it in the healthy cells. which have got healthy mitochondria. And see the result. The nucleic material, cancerous material, is not able to generate cancer process if the mitochondria are healthy. So that proves that nucleic is not the cause, driving cause, initial cause for the cancer. Other way around. What they did, this is a cancer cell, and they put the healthy nucleus, which has got cancerous mitochondria, they put healthy nucleus. If the nucleus is the cause, this healthy nucleus should give signal to the mitochondria and correct, but not happening. This nucleus becomes cancerous because mitochondria are cancerous. So both these things, pratyaksha praman, which proves that it's not the nucleus, but the unhealthy or the cancerous mitochondria are the cause of cancer. So the research carried forward further, the results suggest that tumors do not arise from nuclear genomic defects alone, and normal mitochondria can suppress tumorigenesis. Let us work out on the mitochondria. Very easy, according to Ayurveda, if we understand what is mitochondria. And mitochondrial dynamics are clearly implicated, okay, in all hallmarks of the cancer cells. Yash ko bulana jara 1 minute, urgently. Okay. So this is from Journal of Seminars in Cancer Biology. Crosstalk from the non-cancerous mitochondria. Crosstalk from the non-cancerous mitochondria inhibit tumor properties. Okay. And suppresses the oncogenic pathway. So you have to improve mitochondria. Now they are planning. Now this is 2012, but I have also read a journal of 2021, which corroborates the this bar, which corroborates that mitochondrial transplantation would be the future treatment for cancer. So mitochondrial organelle transplantation in a cancer cell, there are epithelial cells and mesenchymal cells. Epithelial cells are healthy cells. Mesenchymal cells they are cancerous. These mesenchymal cells make the cells, epithelial cells, to cancer. So my needle, if it hits to the epithelial cell, the biopsy will come negative. It has to hit to the mesenchymal cells. Now I know this. So if some science develops a technique that normal epithelial cells, you take out the healthy mitochondria, insert into the mesenchymal, those cancerous cells, and see. Now that is what going to be the future treatment. Of course, it is long way to go, but at least science have started thinking towards that. Probably in next 10 years. And I have discussed this with the oncologists, and oncologists also agreed to it. Yes, there is a possibility. It's not a fancy thing. Okay. So mitochondrial organelle transplantation, 2021 journal also I have read that it can cure actually cancer. So what is mitochondria as per Ayurveda? Now, according to modern science, there are 300 to 400 cells. Mitochondria are there in every cells. There are 10. So in a body, there are 10 million billion mitochondria. Oh, huge number. They are dynamic and morphologically they are fluidy state. They are in a fluid state. Okay. We receive it from mother only. Fathers do not give mitochondria because in the sperm, mitochondria there in the neck, it just pushes the head into the ovum. Okay. The ATP production, calcium ion homeostasis, stress response, cell cycle, apoptosis, reactive oxygen species generation, intracellular signaling regulation, death signal, longevity, aging, these factors depend upon your mitochondria. I think you must be getting the hint what I'm talking about mitochondria to be according to Ayurveda. Mitochondria are vitiated by free radicals, environmental factors, causes mainly inflammatory, metabolic, and neoplastic disease. And its function declines as the aging. And surprisingly, the most important hint is if you do fasting, calorie restricted diet, it improves mitochondrial function. So friends, yes, you might have judged correctly. The mitochondria is nothing but Agni, according to Ayurveda. Agavyaptau is the definition of Agni. Agavyaptau. Everywhere, 10 million billion cells are mitochondria there. So what is more than agavyapto than this? It is present in all the tissues, living tissues. It's in a fluid state, I said. So dynamic metabolic force residing in pitta. Pitta is in a fluid state. We receive it from mother. Any reference? Dr. Srijit will ask me, any reference for the mother? Yes. Artavam Agnayam Saumyam Shukram. So we receive it from mother, and that's why we should worship our mother. For this Navratri, what we do? You do fasting. So you improve your mitochondrial function and you worship your mother. That's what you have to do in Navratri. Okay. So converts food energy to the body tissue. Healthy longevity, strength, enthusiasm, all these things are because of the Agni. It is vitiated by wrong lifestyle, internal humors, and the Bija dosha. So inflicted Agni, you can inherit from the mother. Inflicted mitochondria, you can inherit from your mother. Okay. Declining, that's why many cancers are X-linked. Declining and vitiated, your aging declines the Agni. Okay. And what is the main treatment to treat Agni? First treatment. Dr. Galasar's treatment, Langhanam. That is the main treatment, calorie restricted diet. So when I read this, I was overwhelmed. I said, my God, what Dr. Galasar's vision is. The Langhan, he thought of it. And that is the thing. My another Guru, Vaidya H.P. Sharma ji, he also taught me about the Deepan, Pachana and Langhan, gave me all Sanskrit references about Agavyapto, what is Agni. And I said, amazing, amazing. So whatever I'm able to talk to you, because of the teaching of these two giant personalities. So fasting, Deepan, Pachan and Panchakarma. So what is the definition of Agni? Ayu, Varna, Bala, Swastha, Utsaha, Upachoya, Prabha, Ojo, Tejo, Agnaya, Deha Agni, Hetuka, Shante, Agno, Mriyate, Yukte, Chira, Jivati, Anamaya. What is this? This is nothing but what I showed you, mitochondria, healthy mitochondria, robust health, diseased mitochondria, diseases and dead mitochondria will cause the death. Okay, so this is what Agni is. Rogaha sarvyapi mandagno bhavet. Okay, so this is what Charaka said, and this is what modern science is saying today. Mitochondrial dysfunction will cause all this kind of metabolic dysfunction, cancer, aging. So there's so much similarity. Establish this bond. You need not to explain every Ayurveda principles in modern terminology, but try. If you do this, if you're able to bridge, this is called bridging the gap. Probably all the medical fraternity will come at one pace and we will be able to work out in a better way for the human race. So as modern science says, there are the stages: accumulation of oncometabolites, loss of tumor suppressive functions, unlimited proliferation, invasion, expression. So these are the stages. What Ayurveda says, Sanchaya, Prakopa, Prasara, Sthana, Sanshla, Vyakti, but exactly same. Accumulation of oncometabolites, loss of tumor suppressive prakor, unlimited proliferation, prasara, invasion and colon, sthana samshraya. Okay, and expression, that is Vyakti, and extensive spread meds, that is Bheda. You can't do in this stage. So you have to target to treat these stages. Okay. Now definition of tumor or cancer in Ayurveda. See the word used, you have to study that. Gatra pradeshe kochideva doshaha sammurchita mamsam abhipradushya. So basically all solid tumors, fibroblast and mamsadhatu is affected. Collagen tissue is affected. Nothing but the part of your mamsadhatu. Vrutta sthira mandarujam mahanatam analpamulam. Very deep. The cancer, it may look small here, but it is evading your bones, going deep into the throat. So mahanatam analpamulam. Now see, when I say cancer cells are immortal, they don't die. Chira vruddhi apakam. We said a chiranjeev bhava, don't die. So chira vruddhi, keep on immortal, apakam. As they do not produce full-fledged inflammatory molecules. They are low-grade inflammatory molecules. So apakam. So they will not ripen. Kurvanti manso pachayatu shofam arbudam shastra vido vadanti. So this is what about the solid tumor the Granthakara have described from Sushruta Samhita. So this is, I'm sorry, it is in Marathi. The gland which glows, the growth which glows slowly, which is round, okay, and that is called cancer. And there are various types: Vat, Pitta, Kapha, Shonita, okay. Now we say metastasis. So what is written in Ayurveda? Adhyarbuda. The tumor which has relapsed or recurred at the primary site. We see whether primary after the surgery or chemotherapy or radiation, when patient comes with the relapse, we see on the PET scan if the primary site of breast cancer or lung cancer is there, safe or not. So if the tumor is there in the primary site, again we call as a Adhyarbuda. Dvira Arbuda, which is a metastasis, like at that time or at different time, the one cancer cell of one tissue origin grows to other tissue. So this is called Dvira Arbuda, of the same quality. So osteosarcoma growing in the lungs, so that will have a same osteosarcoma in the lung tissue and also in the bone. So the treatment of cancer is, in Ayurveda, Karshan, first give some medicine to reduce the tumor, then surgery, give the anesthesia and remove it tactfully so that you don't damage the vital organs, and followed by Agni Karma. Why to do Agni Karma? Because you just do surgery and you do not cauterize that part, actually you are going to spread the disease. So many cancer, they are not operated because of this. If you operate and you do not properly, are not able to remove, so that cancer will be get disturbed and the tissues will spread through the blood to the other organs. So you have to cauterize. So that is nothing but a radiation. What today we are doing after surgery, after doing proper removal, proper local cauterization, we do radiation, so that those cancer cells do not spread in the body. Okay, and they are killed. Plus, radiation also corrects the unhealthy mitochondria. It removes unhealthy mitochondria. Okay, and then followed by Rasayana, in order to not to get relapse. This is my role. I am doing this role, Rasayan. Immunotherapy of modern and immunotherapy of Ayurveda are totally different. It's a just word similarity. Okay. So Rasayana Chikitsa of Ayurveda is altogether different. And that's what we will see how to do it. Arbuda, it prevents the relapse of the disease. Now, the cause of the Arbuda in Ayurveda, basic cause is what? Inflammation. So what Ayurveda says? Causes of inflammation and cancer. Excessive sweet. If you read Madhura Rasa, there is a one word used, Arbuda. You read Charak Sahita, excessive consumption of Madhura Rasa causes Arbuda. So excessive sweet, salty, oily, viruddhahara, heavy food, wrong diet, wrong way of consumption. Poison. Who will consume poison? No one will consume. But we are consuming poison every day. We are consuming pesticides. We are consuming water in the plastic bottle. We are consuming tea in the thermocol. We are consuming poison from the dye, from the lipstick, powder. So smoking and alcohol are not the only consumer. From pesticide to all these things are a poison. Garavisha, Kutrim Visha, whatever you call. Okay. Then trauma, Grahani, chronic indigestion. Okay. The T helper 17 are stimulated and that causes chronic inflammation and can lead to cancer. Frequent abortion, abnormal deliveries, malnourishment, these are all Ayurveda causes. Aging, Shuka dosha, and lack of exercise. Lack of exercise. You do the survey and you will find how many Vaidyas are doing exercise. It will be surprising to see that only 10 to 20% of Vaidyas are doing exercise. Okay. So these are the causes of Shotha and cancer. Mitochondrial dysfunction is the root cause of cancer. This I am establishing with this all references and this circulation research 2016. And westernized diet increases the chances of cancer. It has been reproduced multiple times. I have given one reference of 2013, but after that, so many papers are published. So emerging evidence targeting mitochondrial metabolic dysfunction in cancer therapy. Now people are working on this. Okay. So what are the challenges? How to treat dysfunctional mitochondria, how to treat oncogenic signaling pathways, how to improve non-oncogenic pathways, how to treat tumor, how to prevent relapse, how to reduce adverse drug reaction. People come to us कि हमको chemotherapy का side effect कम करने, but you can't block chemotherapy effect. If you block them, the chemotherapy effect, cancer will grow. So you have to mitigate to some extent. You have to explain it to the patient that to some extent, yes, it can be mitigated, but we will give some medicine which will improve the efficacy of the chemotherapy. Okay, as I said in my earlier slide, by improving mitochondrial function. So patient will not have relapse, chemotherapy response will be better. So how to reduce ADR without abrogating chemotherapeutic effects? That is the most important goal. Okay. So if you go to an oncologist and you tell that, sir, we will be blocking the side effects of the chemotherapy, will say, no, we don't want, we don't bother about side effect. We will manage. What you can do for me is to improve the efficacy of chemotherapy without abrogating. I mean, to reduce the side effects without abrogating the chemotherapy effect. That's what you should be able to do. Now, this is from the October 2020 therapeutic potential of targeting mitochondrial dynamics in the cancer. Just giving you reference. So again, this is from 2021 translational oncology. They say targeting cell mitochondria. This is mitochondrial targeted treatment. Okay. And radiation, cellular organelle, they improve the outcome. So radiation also, when you give properly to those mitochondria targeted, the outcome improves. See, so radiation, which is mitochondria targeted, it improves all these factors and improves the outcome and prevent the relapse. So this is chemo prevention, what I said. Okay, the need for it, let us see. 90% of the death in cancer is not because of the cancer itself, but because of the relapse. Friends, daily 1,500 patients or 2,000 patients are dying every day in USA. I think number may be same in India. We are not reporting it. Okay. So this is data from the NICRP. Okay. National Institute of Cancer Research Project, and also from the American Society. Work out something, so that we can prevent this 90% of the death. The treatment of cancer has not changed much. The outcome of cancer treatment from 1950 to 2022 has not changed much. In a way, it has changed because of the early diagnosis. But once the cancer reaches to the second, third stages or fourth stages, the outcome is same. Once the relapse happens, the results are same. Plus, after chemo, surgery, radiation, patient lifetime, many patients, they have to live, cosmetic inability, defects are there. Someone hand is removed, someone breast is removed, this is removed. So that kind of defect, functional defect, cosmetic defect, the cost, patient is not functional, is not able to do work. So you have to work out on these things, that we can, how to improve, the patient's quality of life. No one challenges Lancet. Can I give it? Yes, you can give adjuvant, anything, whatever. May it be a lifestyle change. It will be like an adjuvant therapy. So screen the large mass, see how primary chemo prevention. Take a society, teach them what they should eat, what they should not eat. Try your level. First, you try to follow. Okay. So this is called primary chemo prevention. Similarly, secondary chemo prevention, patient with the preventive dysplasia, you try to give diet, try to give some proven herbs. Here you can do a clinical trial that that breast cancer patient, they are responsible to some medicine. Give some trial, only curcumin, only ashwagandha, okay? And see the outcome is. If outcome is good, accept it, then explore further. Try to do it better with Ayurveda principles. So that will be a second arm of the treatment. If outcome improves, then in the third arm of the treatment, they may infuse both the principles of Ayurveda and the herb and the modern treatment. So like that, we can have a step up approach. Then tertiary chemo prevention. So patient is successfully treated. You want to prevent. Okay. So you give your Ayurveda treatment along with principles. So this is how, you should go. This is the Lancet Oncology 2001 and also published in 2006. So what Ayurveda says, Anuhi prathamam bhutva rogam paschat vivardate. Sajata mulo mushtati balam mayushcha. So when the disease is in a primary Anu stage, nail it. This is what modern science is doing. Early detection, early cure. So what are the pathways? Dr. Rahul, should I continue? I hope people are enjoying.
Yes, sir, absolutely. We have 446 enthusiasts. Maybe Dr.
Great.
Rahul, can you step in then for 5 minutes? Then we hand over to sir again.
Sure, sir. Sure.
Yeah, then 5 minutes, and then we'll come back to you.
Any questions, or you can ask.
Yeah,
Or you
yeah,
want
sir.
me to continue? I can continue.
Dr. Rahul, all up to you. If you're ready, then that is fantastic.
I can continue, no issue.
Yes, sir. No problem. I can.
Okay, I will continue.
You
So
continue,
these are
sir. Continue.
Okay, I will continue. So pathways of chemo prevention. This is from the Frontiers of Development Biology, February 2018. So procarcinogen, any material which has got ability to produce cancer is called procarcinogen. It gets converted into the body, okay, by metabolic activation to the ultimate carcinogen. Okay, I have to prevent this metabolic activation of procarcinogen to ultimate carcinogen. So this is a group 1 blocking agent. Then the ultimate carcinogen will act on DNA, RNA, proteins, and also on the mitochondria. You have to prevent. So that is called group 3 blocking agent. Then group 2 blocking agent, they remove the procarcinogen, whatever way it has entered in your body, and also converted into ultimate carcinogen, you remove. So this is called detoxification, by a process of detoxification, group 2. So like this, we can work out. Now, once suppose it binds to, according to the genomic theory, it binds to the nucleus and promulgate the DNA. Okay, if DNA is repaired, normal cell. If DNA is not repaired, it happens to the cancer process. So if you are blocking, first of all, don't consume so healthy diet, hetu, ahar, vihar, you can take care of it. Even if person consumes, you try to prevent, okay? Try to prevent 2, 3, or you try to remove. A trial was done, published in 2017 journal, that we know that tobacco causes cancer. So this was done on the rats. So green tea extract, polyphenols, chiraita, that is chiraita, amargantine, the active ingredient, and eugenol. So they took 2 groups of animals. In one group, they gave only tobacco. In other group, they pre-treated, primed them with this decoction of this green tea, chiraita, and cloves. And they found that incidence of cancer was much, much less in the group which received this decoction. And what outcome? And the study said that it prevent the initiation, promotion, and the progress of the cancer. So this decoction, they repeated, it restricted the malignant tumor formation. This is what a trial was done, published in a very good journal, Journal of Radiation and Cancer Research. All these research are non-funded by pharma. So they have got a good, authenticity and a good journal. So antioxidant detoxification, they inhibit cancer stem cells and modulate cellular pathways. So this can be used as a regular tea by all. What is wrong in that? It can work. It can work here. It can work here. It can work here. And no oncologist will say no to drink this tea of tea and chiraita and eugenol. You can add Arjuna to it. Good cardiotonic. You can add ginger to it. Ask every patient to drink this tea in the morning. What is wrong in that? No wrong in that. Discuss with this evidence to your oncologist. Okay. As I explained in my first this thing verbally, that G1 growth, most important. Most chemotherapeutic drugs work here. Okay. Then P53 comes here. DNA synthesis G2. So this P53 plays important role. It will stop the abnormal cell growth. It will repair. If it is repaired, it will continue the cell growth. Otherwise, it will kill the cell. That is called apoptosis. So DNA damage, hypoxia, nutritional deficiency, hormones, stress, physiological processes, oxidative stress, oncogenic signal, they all will stimulate P53, suppress P53. And once the P53 is suppressed, all cells, the cancer process starts. So I have to work on the cyclin dependent kinases. I have to work on mTOR. I have to work on improving P53. Okay. So this what I was telling, eating the effect of sweet, arbuda, effect of eating sweet in excess, and effect of eating bitter herbs, it reduces the shotha. Okay. Daha pitta kafana jayati. Anyway, so fasting, ginger, piperine, chitraka, kalamega, tinospora, cannabis, and herbomineral and metals, I will discuss in short. So these all are candidates for improving mitochondrial function, for improving your P53, for reducing cyclin-dependent kinases, for suppressing mTOR pathways, okay, and for work as a chemopreventive effect. Okay, so Ayurveda principles to treat Agni and westernized diet, Langhan, Deepan, Pachan, Shothagna treatment should be useful. Okay. Now ginger. We all know Deepan Pachan ke liye ginger, Mahaushadhi. First is Mahaushadhi. Vishwa Aushadhi is ginger. Fresh ginger, ask every cancer patient to have it in the first thing in the tea. Kapha pitta kam. Those who are very pittakar, don't give them dry ginger. But if you give them fresh ginger in a little quantity, if non-diabetic or even diabetic, small amount of honey, you use your yukti. That patient is pittakar, but you want to use ginger. How to use it? Find out. Use in a small quantity, very small. Don't use more than say 100 milligram, 1 drop of ginger juice. Increase by 2 drop. So what is written in Ayurveda Sutra Sthan? Kramena upachitat gunaha, kramena apachita doshaha, santoyanti apunarbhavam, aprakampyam bhavantim cha. Slowly use the yukti. So ginger's purified component as a cancer, and take this reference and use Ayurveda yukti. Use products which are Deepan Pachan like Ajmodadi, Vaishwanar. Use them. Okay. Again, second paper, gingerol. Now I'm going to show you just paper. I'm not going to read all these papers. Okay. Adenosine monophosphate kinase, it stimulates that, because of which your, mTOR pathways are suppressed. Ginger extract inhibits human telomerase reverse transcriptase in lung cancer. So lung cancer telomerase is reduced. So lung cancer cell is reduced. It will shrink faster. The beauty of herbs, they will act on only abnormal and diseased cell. Because these abnormal or diseased cells, they have certain receptors which will attract ginger and herbs in a more way than the normal cells. Okay. Piperine, pipali, another Agni Pradhan Dravya. Okay. So this works beautifully on all cyclin dependent kinases. So once I suppress all the cyclin dependent, for example, this for G1, cyclin dependent K and cyclin dependent D are responsible. So piperine will stop him. Piperine will stimulate P27, P28, because of which the suppression happens of the abnormal cell. Piperine also acts on cyclin E and cyclin dependent K2. So all G1S phases mein piperine. So use Pipali Ghruta, use Trika 2. You can use it. Pipali Rasayana, the patient is not pittakar, or with the yukti 1, 2, 3, 1, 2, 3 in a Vardhaman Kram with the milk, and reduce again to this is the treatment of cancer in Ayurveda, not just mere having ashwagandha and curcumin. Pipali Ghruta you can use, Pipali Rasayan you can use, ginger you can use. Okay. So it releases mitochondrial membrane protein, cytochrome C, and mitochondria death receptor is stimulated. Unhealthy mitochondria also die. What Pipali is doing? Deepana and Pachana. Deepana means it will improve the Agni function. Pachana, doshon ka Pachan. It removes the unhealthy mitochondria and improves the healthy mitochondria production. That's what I have conferred, I have inferred, and I'm using it. Pipali Ghruta is a wonderful medicine. Sitaram Ayurveda people can look into it and produce a good quality of Pipali Ghruta or Shatkola Ghruta with the milk, so that even Pitta Prakriti patient can take it. There are so many Granthokta formulations. So piperine is a potential inhibitor of. See, it's so important to kill cancer stem cells. Chemotherapy can kill cancer cells, but not the stem cells. I am addressing your stem cells. Okay. So once you address the stem cells which are responsible for producing cancer cells, you kill them, so cancer recurrence will be arrested. Okay. So all MD students, if they are there, or PhD students, or the teachers, my sincere request to all institution, do this kind of research in Ayurveda without violating our principles. That is the main thing. Okay. Otherwise, Gara cell will not spare me. Then piperine, multi-targeted chemo-preventive herb, frontiers in cell developed 2018. Piperine causes cell cycle arrest. Piperine inhibits cancer stem cells. Piperine influences autophagy and endoplasmic reticulum stress, which stress in favor of the cell death. Piperine inhibits angiogenesis. So many effects of piperine. One pipali having so many effects. Okay. Another drug, plumbagine. I am only talking about Agni. Chitraka. This is published in Onco-Target. Excellent for those who are HER2 receptor positive. If the human epidermal receptor growth factor is positive, especially in the breast cancer or the cervix cancer or the ovarian cancer, that cancer spreads fast. Very bad results of that. So if HER2 positive, give Chitraka. Use Chitrakadi Ghruta. Chitrakadi Vati, simple formulation. Our Arogyavardhini contains Rasagandhaka Loha Brashula Basma Trifala Trigunam Chaturgunam Puram Mulam. Puram means Google and Mulam means Chitraka Mulam. So Arogyavardhini contains Chitraka. If you don't want to use metal, you prepare a formulation of Chitraka in a removing the all mineral content from that. Find out what are the Chitrak preparation, Chitrak Grut, Chitrak Haritaki. You read Chitrak Haritaki and it is written useful for the Shoth. We only use Punarnava and Gokru for the Shoth. We never thought of using Chitraka for the Shoth. So think of Chitraka Guru, Chitrak Haritaki for the Shoth. Plumbagine suppresses inhibition of HER2 receptor, again from the journal PLOS 1. Okay, in the breast cancer. As I said, I must thank Dr. Syed Tahir Hussain from Kerala. He taught me about cannabis. Results are excellent. What Bhang is Shivji ka prasad, Shankar Bhagwan ka prasad. Bhanga kafara tikta grahani pachani lagu tikshna ushna pittala moha mada vaga vanni vardhani. It is pittakar, use cautiously. Vaga vanni vardhani. It improves your oratory power. I am not taking it, but I am otherwise also good orator. People say, and vanni vardhini, agni vardhani. Plus it reduces kapha. So the stickiness, adhesionness of the cancer cell is broken up by the bhanga. By tikta, it improves your digestion. Okay. So kaphara, sticky, obstructive and heavy, all these things are removed. So in a kaphaja condition, bhanga is very good. Headache, sinus, glaucoma, nasal polyps, sleep apnea, okay, fatigue, laziness. These are the other indications in which you can use bhang. Heart and vessel blockages, poor appetite, synovial effusion, rheumatoid arthritis. So in that you can use bhang. I'm using it. Okay, what is said? Yogadapi visham tikshnam uttamam beshajam bhavet. Beshajam chapi tikshnam sampadyate visham. But king's permission is required to obtain to use poison or poisonous herb. But bhang is upavisha, subatoxic. So can be used safely. Use cannabis preparation which contain only CBD. If you are not expert, if you are not trained. If you are trained, you can use THC also in a proper concentration. Okay, use in a proper dosages. Don't prolong use it. Give gaps. To be strictly used under medical supervision. And antidotes are lemon juice, babul decoction, babula decoction, arjuna decoction. So give arjuna kshirpak in the morning and give bhang in a prescribed dose. Okay. So these are my almost I have treated. Just a minute, I need to charge. Yash. अरे चार्जर दे यार. हाँ यश दे. So almost 318 patients. I have more than 1,500 patients of cannabis. Charger लाना वहाँ से. Of which 300 patients of cancer. They are on the bhang. Okay. Restless leg syndrome, motor neuron disease, Huntington's chorea, post-fever arthralgia, psoriasis. These are all patients I have treated with that. They're undergoing ongoing treatment. I have got a meticulous way of keeping a record. I use Practo software. I am not doing any kind of advertise, but I use Practo software. You can use anything else. Okay. Yes. And you can use simple Microsoft Excel and keep a data. At the end of 1 year, you will see that how many patients you have used of single drug. So I have a data for curcumin, I have a data for ashwagandha and everything. Okay. So rheumatoid arthritis, and you be honest if there are results or no, and that will really help you. So side effects are head spinning, headache, little sore throat because it is oil based, so sleepiness. Some patients feel constipated, some feel diarrhea. Okay. Transient delirium, especially in the females, it happens. Sweating, nausea, but there are absolutely mild symptoms. They can be self-limited. There are no major cardiotoxic or organotoxic side effects, or nobody had died because of the cannabis in my last 3 years of practice. Okay. So you can start with the Trilokya Vijayavati of a good company, which contains only herbal, the leaves extract of the cannabis. If you're confident, then you can step up to the cannabis, Trilokya Vijayavati, or other drugs which are there in the market, Andronil, different kind of drugs are there. This is the meta-analysis. 200 articles on the cannabis, 96 clinical studies published in Journal of Clinical Oncology 2021. 2 randomized control trials, 6 systemic reviews with the meta-analysis, 4 systemic reviews without meta-analysis, 13 observational and 71 other types of reviews. These are all Western data. Bhang is Shivji ka prasad, but studied extensively in Western countries. So what they found outcome is, after 40 studies, 17 showed improvement. Here 20 showed improvement. Chemo-induced nausea, vomiting. Cancer-related cachexia, not much of the improvement. Okay. So you can use it. You can infuse it with the ashwagandha and other things to find out if the cachexia improves or not. Okay. Utilization patterns, how cannabis was used, whether it was spray, oral preparation. So this kind of extensive study was done on the cannabis. So cannabis treatment, this is a case published in case report Oncology 2017. Cannabis extract treatment for terminal acute lymphoblastic leukemia. This girl was dying. She has received chemotherapy and everything, and she was not responding. Okay, so a case study, 14-year-old diagnosed with the very aggressive acute lymphoblastic leukemia positive for Philadelphia chromosome mutation. Already bone marrow transplant was done, chemo was received, and in spite of that, she was having. So they started only CBD without THC, and they procured good quality. What they observed was, if the good quality of CBD is given, sometime while procuring, they got bad quality CBD. So again, the result came down. So good quality of CBD in an optimum dose. This girl is now in a remission, disease-free stage. It showed dose-dependent response in the reduction of the blast cells, which are the abnormal cells. Okay, and the complete remission of acute lymphoblastic leukemia. So they ask certain question: is it a spontaneous? Sometimes it happens in cancer. The disease go in a spontaneous remission. So it happens. I feel I have cured, but no, cancer is got cured itself. We don't know how. So they ruled out whether spontaneous remission. So the answer was no, it cannot be, because as the dose dependent response curve was clearly evident. If the cannabis dose is reduced, cancer is to increase. Okay. Cannabis increase, cancer reduce. So it was not a spontaneous remission. What are the factors affecting this result? Frequent of dosing and poor results when interval was more than 8 hours. So they gave 8 hourly. If they gave 12 hourly, result reduced. And the potency, it has to be optimum potency and good quality. They also try to find out whether the outcome of the other therapy. So the child was not on any chemotherapy. They have analyzed the blood of the patient and they found no stresses of chemotherapeutic drugs. And now most important, who documented? Somebody who is influenced has documented the trial? No. The trial was documented by primary hematologist oncologist from Sick Kids Hospital, from the third hospital. So third party auditing was done. So this is how the trial was done. And they found that cannabis is very useful. The side effects, most advanced chemotherapy failed to control the blast cells and had a devastating side effects. But cannabis had no toxic side effects, only psychosomatic effects were seen, occasional disoriented memories. Although she was given only CBD, but CBD also mimic initially, as Dr. Tahir, I asked this question to Dr. Tahir also, and he explained that sometimes it also acts like a THC in the brain, and transiently patient may get psychoactive. So what are the other observations? Increased vitality, but the patient vitality increased, energy levels increased. The dose of morphine reduced. I have experienced this. My 3-patient dosage of morphine was totally reduced because of the cannabis. They were not responding to morphine patch. 1 patient died, of course, but died peacefully. And all morphine and everything was withdrawn and she was only on cannabis. Okay. So she was not drowsy all the way. and increase alertness, euphoria. These are the observation. Psychoeffective can be minimized, yes, by slowly titrating the dose. Most important thing. Okay. Now, how cannabis, the cannabis, it kills the cancer cells. The particle of these killed cancer cells, the tumors, are presented to your macrophages and dendritic cells. Dendritic cells, they get charged. They produce antibodies which are specific to these cancer cells. Okay. And then they get attached to the cancer cells and they kill. So this is how, cannabis beautifully works like a, vaccine, internal vaccine. Like vaccine will stimulate your specific disease producing antibodies. So cannabis works like that. In fact, all our Ayurveda herbs work like that. Now, any infection for that matter or the disease like cancer, it will try to douse your immunity. So your macrophages, they play important role. Macrophages, once they are exposed to the infection, there are two ways, M2 and M1. M1 is a very active macrophages. If macrophage turn to M1, that will be aggressive. It will produce tumor necrosis factor alpha, interleukin 1, 12, and this will kill infection. What your infecting agent, for example, typhoid, it will make your macrophages to M2. So M2 is a very silent one. It will not produce any kind of inflammatory or cytotoxic molecules, and which will allow the typhoid to grow. So this is called immunosuppression. The macrophages are not working. Quality, they are just idle. They're lazy. And your cancer cells, your infection, they try to make your macrophages lazy by turning them to the M2. Cannabis, guduchi, ashwagandha, they all make macrophages M1. This is called immunomodulation. But once the disease is cured, the same ashwagandha, guduchi, and tinospora will stimulate T regulatory cell and will douse macrophage. This is the beauty of Ayurveda. You must read all these papers. Thank to Dr. Nirmala Rege, who has done this research, extensive research from KM Hospital. Okay, you must go through all these papers. The cannabis, these are the multiple ways, it generates ceramide into the cancer cells. So the cancer cell die. Okay, see here I must have written through various receptors it prevents proliferation, it causes death of the cancer cell, and it causes autophagy. Wonderful concept of autophagy. So your own body cells, they eat cancer cells. That is called autophagy. That is improved by cannabis. So these are the various. It prevents the epithelial to mesenchymal transition. Mesenchymal are the cancerous cells. It prevents tumor angiogenesis. It prevents invasion. It has to be given for the long time. So these are the various effects of CBD on mitochondria. Okay, it improves mitochondrial healthy function. Okay, in a nutshell, what I want to say. So these are the on kinases cannabis work. So anti-cancer, say it upregulates the apoptotic proteins, reduces anti-apoptotic proteins, inhibit cyclin-dependent kinases. This is from the Journal of Integrated Medicine from India. Okay. Preclinical research. So inhibits chemo resistance. So cannabis can be given along with chemotherapy. Don't give on the day of chemotherapy. That's it. Okay. The desired effects and all those things. Ashwagandha. Ashwagandha works. Again, now matter is same. It works, improves anti-apoptotic and reduces anti-apoptotic. The beauty of ashwagandha, it also acts on the stem cells. Published in Journal of Research, Cancer Prevention Research. So once the chemotherapy will kill all these tumor cells, but will not kill the stem cells. They are regenerated again. Ashwagandha acts on the stem cells through certain receptors. So once they are killed, cancer doesn't grow. This is published in Cancer Research 2014. So there is a beautiful result of ashwagandha on breast cancer, suppression of the self-renewal stem cells. Many people ask me, can we give this medicine along with chemotherapy? So this is with the sorafenib, one of the beautiful, very strong anti-cancerous drug. So when this sorafenib and ashwagandha was given, the result was 89%. 35% increase arrest in the G2 phase. So there are the synergistic effects. Show this paper to your doctors, American Journal of Surgery. As such, we are in the slavery mindset always. We accept whatever comes from the West, unfortunately. So show this paper. Okay. So enhancement of paclitaxel in combination with vithafeni. Okay. Journal of Chemical Biology, 2006. So with paclitaxel, with sorafenib, ashwagandha works beautifully. Okay. Again, along with the fatigue and the cachexia reduces because of the ashwagandha. Journal of Integrated Cancer Therapy. So these are the various functions. Improves natural killer cell function, significant anti-tumor radiosensitizing effect. It can be given during radiotherapy on the radiation days. Turmeric. Okay. So mitochondrial targeted curcumin exhibits anti-cancer effects. Curcumin mainly, they are trying to develop the formulations which will act on the mitochondria. Okay. So upregulates pro-apoptotic factors, reduces anti-apoptotic factors. Okay. Paclitaxel and curcumin can be given together. Okay. Journal of self-assembled camptothecin derived. So along with camptothecin, curcumin can be given. This is my paper with Dr. Manish Agarwal, sir, done in Tata Hospital. Okay. So we have clearly said we have done trial on osteosarcoma, very worst disease. It was the 4th stage. So our goal was clear to see the quality of life, whether improves, whether curcumin is tolerated and what dose. Out of 24, I think 2 patients only survived because it was all stage 4 relapsed cancer. But quality of patient life improved. We established the dose, that how much is required. We didn't reach to the curative dose. Very difficult to reach to that dose. Even we gave high dose because curcumin body washes it out. Small is only absorbed. That is the biggest issue. The beauty is curcumin alone will not get absorbed. So I suggested them to give curcumin ghruta. So we produced lipidized curcumin. So there was a special formulation produced by Farmanza Herbals. The name of that, I'm not marketing, but I'm telling you, sharing you. The Long Vida. And the other one is Nucleo Plus. So these two contain the special curcumin formulation, lipidized curcumin, which gets absorbed and the results are enhanced. Okay. Andrographis, Kalamegha, one of the bitterest alkaloids plant, has got effect on cancer. Okay. So you can use that again, same upregulation of apoptotic and anti-apoptotic reduced. Most common topic, modern medicine, they criticize us for using bhasma. But what I say, if cisplatin, which is toxic, is used since 1978, why can't we use our metal complexes like gold, copper, zinc? This is published in Metallic Complex, Cancer and Metastasis Review, October 2017. So try to find out. So I am also doing research on gold nanoparticle in my University of Mumbai with Dr. Manu Lopas. And results are good. It is in an experimental phase that gold nanoparticles work beautifully on the breast cancer cells. Okay. Through other way, it kills cancer cells. That I cannot disclose now, but there are certain pathways through which, cancer cells are killed. So so this was the Krypton stabilize. This was the comparison study. Tryptophan stabilized gold bhasma and Ayurveda bhasma. Basis on this paper, I am doing the research. Okay, so our bhasma works better than the tryptophan stabilized gold nanoparticle. Okay, again curcumin. Now coming to the diet. Fasting, everyone knows this person, he won the Nobel Prize, okay, in 2015 or 16. But my guru, he has taught me Langhana in 2090. Not 2090, 1990. Okay. So he should have got the Nobel Prize. So fasting improves the, the healthy mitochondria. It improves the efficiency of electron transport chain, ATP production. As I said, unhealthy mitochondria, which produces less energy and produces more raw material, more ama is produced. Dhatu, excess dhatu vruddhi, according to Ayurveda, is because of Agni Mandya. Agni Mandya produces dhatu vruddhi, and Agni vruddhi produces dhatu kshaya, what is written in Agbata. The same principle. So improves Agni Mandya, Dhatu Vruddhi is reduced, Samata is reduced. Okay. So improves efficiency of this fasting. It has got effect on the DNA. So not only mitochondria, your DNAs are corrected. Okay. So 36% reduction in the metastasis due to down regulation and reduction of insulin-like growth factor 1, interleukin 6, tumor. These are all evidenced, established. Upregulation of adolase, P53. This is published in Onco in October 2017. Increases autophagy of in healthy cells. So one who is doing 9 days fast, proper 9 days, all sapta dhatu, abnormal dhatu ka autophagy apne aap ho jata hai. Kafaja prakruti people should do it. Okay. Increase apoptosis in cancer cells. Errors in DNA are replication are reduced by fasting. No medicine can do this, but fasting can do it. Okay. Now, here I asked many oncologists, can we do a fasting trial? Useless. See, this is the American trial published in BMC Cancer Medical. 48 hours before chemo, they gave fasting. And during chemotherapy, the chemotherapy was well tolerated. Bone marrow suppression was not there. Those who underwent fasting. Okay, the fasting plus chemotherapy cycle increased cancer-free survival in 20 to 60% of the patient. Okay, calorie restriction coupled with radiation decrease the metastatic burden in triple negative breast cancer. So at least ask your cancer patient to give calorie restricted diet. Don't ask total fasting. What I will tell you. So now they are also doing a trial for 70. I think they must have completed 72 hours of fasting. Okay, there are some papers are there. This is prolonged the length and the nightly fasting. 16 hours of fasting if you give, that is also useful. That is intermittent fasting. So this is published in JAMA Oncology. See, these are very good journals. JAMA, Lancet, British Medical Journals, they are excellent journals. Now, as I said, show me the evidence. Dr. Srijit will not spare me if I don't give the evidence. So this is the biopsy evidence. If the person is doing fasting, the mitochondrial function improves. Mitochondrial markers are improved. Healthy mitochondria are improved. Insulin sensitivity is improved, which will reduce insulin-like growth factor and which will reduce inflammation. And insulin resistance is reduced. Sugar control will improve. So this is a biopsy evidence. Okay. Uncoupling protein. We Indians are obese, although we don't eat much as compared to West, but we Indians have coupled protein. I can arrange a different chapter, different lecture on that. What is uncoupling protein and how Indians are prone to develop because of the deficiency of uncoupling protein and how Ayurveda is useful. So it improves the fasting, improves the uncoupling protein 3. So obesity reduces, but it has to be calorie restricted, not total fasting. Let us not discuss about that. So this is published in Lancet and Post Journal Medicine, UK. Okay, 21st century. What fasting they say? 800 to 1200 calories, no animal protein, no gluten, only omega-3, no added sugar, rice gruel, juice of raw vegetable. What Ayurveda said? 4,000, 5,000 years before, Ashtaguna Manda, Peya, Vilepi, Yusha, Gogruta, Sarshap Tel, Susamskruta Jangal Mausarasa. Use this. Give them not more than 800 to 1200 calories. It almost fulfills all these criteria. Prana virodhinam chayanam langhanam upapadeti. Vata prakriti give less langhan, kapha prakriti give more langhan. Bala adhishtanam arogyam yadartho ayam kriya kramaha. Langhan should not be overstretched. Okay. You can take help of Dr. Hima to understand Mala Pariksha. She is excellent in that. You must have heard her lecture. So if the proper fasting is done, how the Mala is, I'm not expert in Mala Pariksha, so I take her help. So what are the diet to improve cancer patient? Improve mitochondrial function, light for digestion but nourishes, improves the immunity, okay, and which can stop all these things. How much to eat, hitam jirne mitam cha, these are all common principles even first year, second year student know. Generally, I ask patient to avoid curd, tuar dal, outside sauce, pittakar, fruit plus milk, all our basic principles of Ayurveda, of Ashtau Ahara Vidhi Vishesha Ayatan to be followed. Avoid non-veg if possible. If not, at least avoid after 6 p.m. Okay. Don't drink much of water before, during, after food. Avoid sabudana, avoid maida, avoid afternoon sleep. Okay, very normal. These principles of Ayurveda is to be followed. Diet during chemotherapy, give Arjuna Kshirpak in the morning. As I said, give that green tea, eugenol tea. That is very good during chemotherapy. It will reduce the side effects. Sabja you can give to reduce the heat. Okay, this alkali smoothie is very good. Palak, pudina, coriander leaves, apple, banana. But of course, if Agni Manda is there, don't give, avoid. That has to be decided by you all. So chemo preventive potential of fasting to be further evaluated. I think this slide missed the number. Now, concept of immunity. Modern people, they only say immunity, cellular immunity, like, the T cells, adaptive and innate immunity. Of course, there is a mucosal barrier and acid and your tears and all. But basic concept of Ayurveda allopathic is innate immunity and the adaptive immunity, T cells, B cells, neutrophils, and this. What is definition of Ayurveda? Vyadhi pratikar shakti, vyadhi utpada pratibandhakatvam, vyadhi bala virodhitatvam. Where it is written, Charak Sutrasthan 28. शरीराणी च अति स्थूलानि अति कृशानि अनिविष्ट मांस शोणित स्थीनि दुर्बलानि असात्म्याहार उपचितानि अल्पहाराणि अल्पसत्वानि च भवन्ति व्याधि असहानि. Wonderful definition. No one can match. Having normal T cell, normal B cell, normal macrophages will not confer immunity. If person is obese, if person is ati krusha, if person is durbala, what is bala? What is bala? So bala is written in a charak sharir sthan. Balavata purushe deshe janma balavata kale kulecha sukascha kala yoga bijakshetra guna sampanna. Look at the hereditary history, where person was born, which season he was born, if the mother was nourished properly or not, if father is a smoker, alcohol, father's diet, that is the bala. Okay. Aged person, weak immunity. Okay. Sharira ati sthulani ati krushani. Okay, anivishta maunsa shonita asthini. Such a beautiful word, anivishta maunsa shonita asthini. What is the meaning of anivishta maunsa shonita? So sthula and krusha is because of the meda. Anivishta means abnormal maunsa dhatu, abnormal rakta dhatu, and abnormal asthi. I will show you my first patient of cancer. She is my mother. Come. She is my mother. Just look at them. She is 80, she is 75 years old. She is a breast cancer patient, survival. Treated her, only lumpectomy was done. After that, she did Langhana for 8 days. Am I right? She did Langhana, and now also she is doing fasting twice in a week, Monday and Wednesday. Only once she eats. She was stage 3 locally advanced cancer. During chemotherapy, no side effects because of the drugs, whatever Ayurveda drugs I gave. At that time, I was not doing any research. So plain basic principles of Ayurveda I followed and I gave. Thanks, mom. Yeah. So durbalani, the one who is durbala, asatyamahar upachitani. Your T cells, B cells are good, but if you are eating pizza, burgers, asatyamahar, you are not going to have a good immunity. To improve our immunity is this wide spectrum. Use herbs which are useful to improve, to correct this anivishta maunsa shonita asthi, ati sthula and all those things. Okay. So Langhan, Deepan, Pachan, these are the drugs, Vaishwanar, Sitopaladi, Ajmodadi, onco-preventive herbs as I have proven in the various slides. Dhatu Balavardhak, Rasayan, Pipali Grutam, Dadimadi Grutam, Chitraka Grutam, etc. Mahamanjishtadi Kadha, Punarnavadi Kadha, all these things are very useful. You can use it as per the stage and as per the disease. Okay. These are my certain patients. I have not updated it last 1 year or 2 year rather. Number of patients I have treated, and till date there are no recurrence. They are in touch with me. There are 3 cases of multiple myeloma. Those who have undergone bone marrow transplant, there was a relapse and now they are normal. One lady, 74-year plasmacytoma, she didn't undergo any chemotherapy, nothing. I have taken a written consent and she is following only my diet and medicine, and still date she is normal. Okay. So CS cervix, breast cancer, treated case of multiple myeloma transplant done. So this lady, I think, plasmacytoma, no chemotherapy, nothing. So, as I said, almost 2,000 people are dying every day. What should be the protocol for Ayurveda? 90% death are because of the your relapse. So follow the Ayurveda diet, swastha vritta, sadavritta. Most important thing. Even Maun helps. If you do Mauna, Udana Bala increases. And increase Udana Bala will increase your Bala. Balam Udano Adhishtate. So you should improve your Udana Vayu. How to improve Udana Vayu? By following Mauna for 1 hour or 2 hours in the day. Try. Most of the singers, barring certain exceptions like Lata Mangeshkar and Asha Bose, most of the singers, they die early age. Why? Because of the constant singing in a high pitch. That is what my observation is. I may be wrong, but this is what I have observed. So constant speaking, loud speaking is bad. Ask patient not to indulge into all these activities. Okay. So mitochondrial dysfunction is the most essential pathology in the cancer initiation, growth, metastasis. DNA mutation is the consequence of mitochondrial dysfunction and continue as an important contributor thereafter in the pathogenesis of cancer. Mitochondria depicts as the structural and the functional organelle of the Agni, and treatment of vitiated Agni should improve the mitochondrial function and biogenesis and hence the cancer. So friends, it is very easy to kill cancer cells, but challenge is to keep the patients alive at the same time. And at present, the challenge in front of me and Dr. Srijit is to keep you awake. I hope all are awake so that you can ask me questions if there are any. Thanks a lot.
We had easily 444 enthusiastic
Great, sir. Great.
throughout the process. I had requested Dr. Rahul, and he did already that, to show the specific picture where our legendary Dr. Devchand Gala sir and you are there in a selfie. We always know there is something. I don't want to sound paranoid or being critical about anyone or any group of people. The two ways of being good: one is to be good, and second is to make others look bad. So I'm not doing the second one. I'm just speaking for the good. So we all know very well that if there are successful students, there has to be a great mentor. No discounting the merit of student. That's totally acknowledged, no doubt. So what Dr. Devchand Kala sir has done has been mentoring, very bright, brilliant students. You yourself being teachers, of course, at some or the other point. And it was important for me and perhaps for the entire audience that people see if you all can. You are 391 of you now, and at 12:20 or at 12:19, I had requested Dr. Rahul to please put that picture. Respected audience, kindly spare 2-3 seconds to know Dr. Devchand Gala sir. He has agreed to bless us on 30th of October, Sunday, AACHAARA Rasayana, with a very fantastic topic that of course we will be declaring further and further, because even though I use the word even though, from the allopathic sector, his contribution towards the Ayurvedic popularity, an unsung hero, let us put it that way, one simple word. Again, I say I'm not trying to be foul-mouthing against any lobby or whatever. Many a times, many great legends, they prefer to be in their own space. They're not making any halla gulla shore, but they're shore machawa. It's nice to be, silent and magnanimous, but sometimes I do feel that we have to show the strength. And in this world, I may sound a bit rajasic, but anyway, I will blame it to my Pitta Prakriti. But in this world, only strength respects strength. So why I use this point here, and Nitin sir, you have been very pragmatic not to reveal certain other information where the entire work was done by you, and the credit was unfairly taken by some people. I don't want to say those names, but God will take care of their bad karma. But at least you have just kept your contributions hidden when you should have been actually more acknowledged. It's not about acknowledgement. We are not thirsty for acknowledgement. We care a bloody damn. I use the word bloody damn, what people think about us. But for any science or any information, it has punya and grace when the source is acknowledged. I think that's very important. In here we say gurutvam. Gurutvam is not heaviness. That's not the word. It is the guru aspect, the teacher aspect. Like once we acknowledge the source, it's not just the grace. The effect is great, and that's what we strongly believe in. And I think that is a good message for all the Ayurvedic doctors. Many of them are youngsters. I think as they grow up, they can have the habit of acknowledging and exposing. That's the word I would use. The true meritorious teachers who are always mostly very shy, perhaps they keep themselves low profile. And I think it is high time the community of Ayurveda in Kerala realizes the contribution of Dr. Gala sir, and of course of other mentors whose name we don't even know, unfortunately, because we always and every day, at least I do in Agnihotra 7 times, Vande Ham Guru Paramparam, 7 generations above me or before me, and Vande Ham Vaidya Paramparam, 7 generations above me or before me. So I think when we have that kind of a collective, the strength of the collective consciousness of our gurus, then only we get opportunity. Unless you get opportunity, you will never be able to put into practice what Nitin sir has conveyed here to us. That was the first point to communicate, that we have to derive opportunity. Once the opportunity comes, we are able to perform because we have information, and information is power. But that is not enough. We will have to document it as best as we can. We may not be always able to correlate with the perfection and the clarity of getting all the microest level of narration Nitin sir has made. At least if it can be shown as evidence of effect, that's still great. The patients may not worry to these level of details, but if you have to convince an allopathic doctor, well, it's their need to be convinced or not, that's a different thing, but still it helps to connect a bridge with your counterpart if you speak a language that they know better. I mean, if they have the openness, At one side, when you are so precisely showing the evidences, be it ginger and curcuma, we have a bloody stupid doctor, hepatologist, and a literate illiterate, or rather a literate self-confined idiot, that's the word I would use, who was claiming on YouTube, and the name is known to everyone, it's somewhere in Kochi.
Sorry, sir has some technical network issues, I think.
And how you correlated it with the latest findings from our science, and how the Agni went on time and again, and the precision of the medicines you had made, and the caution you made in the very beginning कि लंगन हो रहा है शायद कुछ ज़्यादा ही fat हो रहा, like no too much of langan sometimes, hyper langan. And in our science is all about balancing. It's just a constant endeavor. Ayurveda, we all know, is all about balancing. I don't think it would be prudent to have the same amount of excess langan to a Vata Prakriti person or a Pitta person when he cannot actually tolerate. So we will need to be that personalized with regards to the protocol that we implement. But at least, sir, you have given us a dhancha, a structure, which we can always fill up based on what we find with a patient. And the most striking point I have realized here, that you not only went to the level of the Agni, you also went to the Rasayan, and you made a sharp line of the, what we say, the Bal. I think I will owe it to Vaidya Tapan Kumar sir, Tapan Vaidya sir in Ahmedabad. We all know him. He has been the core person to propagate the idea of Rasabal, Raktabal, Mamsabal, kind of those protocols, which we all know is very popular in north of India, more than it is in Kerala. I think that is a good reminder to all of us that when we take care of the Agni and the doshas, the dhatu strength is perhaps lost somewhere. Unless that happens, that doesn't give the best impact, at least to prevent recurrence. And the way Ashwagandha was brought in and the studies, it is so convincing for anyone who has an open mind towards integrative approach towards the oncology treatment. It just goes perfect. So, Dr. Rahul, we have more of thankfulness and what we say, appreciations for Nitin sir, because the way he presented, there was hardly any question left out. However, to all fairness, or in all fairness, I think we must still read out the questions one after another, and we have been making repeated requests as far as possible to make the Q&A, and I think let us get to the questions one by one from the Q&A as opposed to what is already there in the chat box. I think now, Nitin sir, can we get into the question answer? But Dr. Rahul, do you mind stepping in and doing your part of duty? Then no, we can get in the Q&A. If it's okay.
Yes, sir.
In short, 10 to 15 minutes because I have to leave for some other program. So if you can be, speed up,
Yes.
that's it.
Yeah, Dr.
Okay.
Rahul, quickly, and then we hand over to sir.
Yes, sir. Thank you, Nitin sir. It was really a wonderful brainstorming session. Thank you for sharing your vast knowledge. And I am moving to my part of presentation, the product presentation part of today's webinar. As you all know, Sitaram Ayurveda conducting as a part of our 100th day celebration, Sitaram Ayurveda 100 years of healing legacy. And we are manufacturing around 450 classical formulations, and among them, few of the products which was highlighted by Nitin sir during his presentation: Ashtachurnam, Inguvajadi Churnam, Panchagola Churnam, Inguvajadi tablets, Samruddharam Kashayam and Kashayam tablets, Mahamanjishtadi Kashayam and Purnavadi Kashayam. These are the few classical products manufactured by Sitaram Ayurveda. And apart from this, we are having other formulations also, and we are having around 450 classical formulations. And another set of product that is helping in the Deepana Pachana context, the Shadharanam capsules. We know the Shadharanam, which contains the Gomutra, and it cannot be, sometimes the patients are not ready to take the medicine because of the smell. And so we made into a conclusion that we can make it in a capsule form so that it will be easy to consume. And then it happened, the Shadharanam capsule from Sitaram Ayurveda. It is packed in plant origin capsule shell and easy to get disintegrated and absorbed, provides neutral smell and taste, and it is a 600 milligram capsule. And also we are having Shadharanam Kashayam and Shadharanam Churnam from the Shadharana Yoga. And also we are having few of the classical special classical products. One is Chitra Grandhikadi Kashayam, that is from the yoga of Sahasra Yoga, Chitra Grandhike Erenda, Shundi Kwadaha Parabhidaha, Shulanaha Vibandeshu, Sahingu, Veda Sahindavi. It is a combination which is indicated for the Shula, Anaha, and Vibanda, and it can be taken along with the Hingu, Vidalavana, or the Sahindavalavana. And another formulation, the Misraga Sneha, and into a capsule form, the total capsule form. In the indication, we can see that it is for the Gulminam Sramsana Vidam, and also for the Vriddhi, Vidradi, and Shula, and also in the Vada Vyadi context. Misraga Sneha in the soft gel capsule form from Sitaram Ayurveda. And the next one is a patented formulation from Sitaram Ayurveda. There is a Prana capsule. The major ingredients are Ashwagandha, Amalagi, and Yashti Madhu. It is an anti-stress nerve tonic that revitalizes your body, mind, and slows down the effect of aging and also strengthens the immunity. There is a Prana capsule from Sitaram Ayurveda. And the next is a product. It is a Haridra combination. It is a combination of Haridra. We all know it is the oldest brand of Sitaram Ayurveda, Alarkan powder and tablets. It has an antihistamine action of Haridra supported by Triphala and Trivrit added with the Gokshuram and Kasisabasam. It is very effective in both respiratory and skin allergies. Also, it is a palatable, non-sedative, natural protection against allergies. It is coming in two forms. One is tablet and in a powder form. It is a chewable tablet of 1 gram size. It is an improved, comprehensive anti-allergy for Allergan Sitaram Ayurveda. Next one is a classical product which is very specially manufactured by Sitaram Ayurveda in its classical size of Vividagi Pramana. It is a mighty Shilajit Rasayana from classical Ayurveda, the Shiva Guliga, which is potentiated with Jivani Ganam and Gomutra. It is very effective in metabolic, liver, spleen, and urinary disorders, and also it is a well-known Rasayanam, and also it is very effective in diabetic complications, including impotence. It is coming in a 4.5 gram size pills with Vedaki Pramanam as mentioned in the classical textbooks. Ultimate Shilajit medicament in its original size and efficacy. And the next one is a set of products which is launched recently by Sitaram Ayurveda. There are the single herb vegan capsules. We are manufacturing single herb extracts into 600 milligram vegan capsule form, and we are having 10 varieties of the same Amla, Ashwagandha, Brahmi, Gokshura, Gugulu, Kapigachu, Shalagi, Shatavari, Tagar, and Triphala are the varieties of single herbs. And the importance is that it is coming in a vegan capsule that helps to ensure the easy disintegration and also shows easy absorption. The single herbs, and the next one is the Kasham tablets from Sitaram Ayurveda. They are coming in a 1 gram size, and one tablet is equal to 8 gram medicament. And in a day, if you are taking 6 tablets, 6 into 8 will give 48 gram of medicament. That is equivalent to 1 pala of the medicament, which is required or mentioned in the API standard for the Kashayam. And we are having a comprehensive range of 36 items also, which helps for the complete absorption, and the disintegration time is less than 25 minutes. There is a Kashayam tablet, largest range of bigger, better absorbing Kashayam tablets from Sitaram Ayurveda. And also, I would like to introduce a new project that we have launched 2 weeks before. It's a Yoga Amritam. It is for to know about the yogas, etc. I hope it is reaching to you through WhatsApp, etc. And in that, we are mentioning the yoga of that particular product, and also the major ingredients and its indication, etc. are highlighted. And also it comprises one experience sharing by any of our senior faculties from the Sitaram Ayurveda Specialty Hospital. And to receive these notes of Yoga Amritam in your WhatsApp, please send a text to 813-8888-932. Please note the number again, 813-8888-932. And also to know more about Sitaram Ayurveda, AACHAARA Rasayanam and our products, please log on to our website www.sitaramayurveda.com. And also please note that we are sending e-certificates to all the participants who are attending this webinar for more than 75 minutes. And also we are sending the notes and recordings to the email IDs. The registrations are used for registration by the subsequent Saturday. And sometimes we are getting queries regarding the notes and recordings that they are not getting the notes and recordings in their inbox. We are sending it as a mass mail campaign to 14,000 plus doctors. Sometimes it will go into the spam or promotional or career folder. So please check those folders also. And also please save your email ID so that the mails will directly come to your inbox. Support at sitaramayurveda.com. And also, we have another options to receive the notes and recordings through WhatsApp. We have a phone of AACHAARA Rasayana, and the number is 89434-41881. 89434-41881. If you are sending a text to this WhatsApp, you will get the recordings and notes through WhatsApp. And also in our website, there is a slot for the AACHAARA Rasayana webinar. Once you enter www.sitaramayurveda.com, you can see one slot, namely AACHAARA Rasayana webinar. Once you enter that, you will get into a next page. In that, you have to fill your name, etc. And you have to verify your phone number. Once it is verified, you will receive the credentials, the login ID and password to your email, so that you can directly enter into the Teachable. It is called a Teachable link. In that, you can directly enter, and then you will get all the recordings and notes in that website. Also, for any support from Sitaram Ayurveda, please contact our customer relations manager, Mr. Rajiv, at 9072613194. His mail ID is crm.osk@sitaramayurveda.biz. And once again, thank you all for patient listening. That is the end of my presentation. Over to Srijit sir for continuing the session.
Yeah, dear Dr. Al, thank you. We all know Sitaram is very, very enthusiastically promoting the idea of Shastra and Shastra. Shastra is, of course, through these very, very enlightening webinars. And the Shastra is, of course, the medicine. Without Shastra, how can we implement Shastra? And whatever innovations done, maintaining the authenticity, keeping it as modernly applicable and as modernly friendly. So thank you, and also letting us know that the new program of reintroducing our classical yogas with their very, very friendly indications. Thank you for that. I hope all our doctors would be availing good use of it. Sir, I'm making selected questions only because many of them have been already answered. So the most prominent one is about bhang. How much amount of bhang, Dr. Jagdish Yadav, how much amount of bhang should be used and how to use for better results? Where to get, I'm clubbing similar questions, where to get Trilokya, Vijayavati and other cannabis products. So the question is very specific. How can we use cannabis? I mean, your recommendations of any brand or any dose whatsoever.
So yes, definitely it's a brand specific also. You should get the good brand and one which is having a good quality of CBD and the THC. So initially to the female patient, basically you can start with the only CBD component, or you can start with the Trailokya Vijaya company, Trailokya Vijayavati. I use of Pillcraft company. It's a very good brand. So Trailokya Vijayavati of the this Pillcraft company, you can use it 1 BD or 2 BD, even in the rheumatoid arthritis patient, osteoarthritis patient, and in the cases of the cancer as a prophylaxis you can use. And then you can slowly step up to the only CBD and CBD THC combination of 1:1 or 4:1, like 4 CBD and 1 THC. That will all need a proper training. But to start with, you can start with the Trailokya Vijayavati. That will be very safe to use, no side effects, and I mean to say no organotoxic side effects. Some patient may develop loose motion or constipation, but definitely it is very useful for the pain also. And if you are confident, use CBD oil, 30 milligram, 60 milligram, that it comes in the special formulations. So you can use 0.5 milligram, 0.5 ml twice a day, 1 ml twice a day. So you can titrate the dose. The study was done and which says that CBD is safe, absolutely no problem up to even 350 or 500 milligram. But we give very small dose. We give 15 milligram, 30 milligram, 60 milligram. So in that there were no side effects of found of the CBD.
Yes, sir. Sir, it is a hemp street which has this Trilocazine. Which one would you recommend?
I use Pillcraft. Pillcraft.
Sir, if you could type for us so that nobody makes a mistake. Yeah.
Trilokya Vijayavati. And there is another formulation called TV750, which is also Trilokya Vijayavati, but higher dosage of cannabis and Onco-preventive. Pillcraft.
Yeah.
Company.
And so you had mentioned CBD up to 1 ml twice a day is safe.
Yeah, CBD you can give say 60 mg per day.
Yeah.
Start with that. You can give that much.
Yes, 60 mg per day. Because it is important to have a meaningful conclusion to this webinar that people can directly contact. If there is any contact number of whatever person, then bank, it is between the doctors and the service or the product providers, then it becomes perfect.
Yeah, so THC not more than 2 to 5 milligram per day, and 91673094733, Mr. Bhushan from Pillcraft.
So it's a simple conclusion that we can easily rely on the CBD more easily, without much. Yeah. Sir, I think we'll get the screenshot. I think we'll just make that. So we will be sharing it with as many people. As we know, we are not kind of promoting any specific brand. It's just that we want to be sure that we are using the right kind of brand and the right, because it's used by you. So we can just close our eyes and just be confident about it. As
Yes, sir.
Just moving around and trying to search. Absolutely fine, sir. So this is one thing done. How to use bhang for prostate treatment, quantity for use? Will you use the same answer, sir? You would go for the same answer.
Sorry, which one, sir?
Bhang for prostate cancer. You would use the same.
Yeah, bhang for same CBD. I use CBD.
Yeah. And dose of ashwagandha. I don't know, Dr. Preeti meant.
Now, sir, ashwagandha, what I use is these are the specific ashwagandha and curcumin I use of this Parmanza herbal.
Yes, sir,
because they have developed the special curcumin.
Yeah.
Parmanza herbal. Parmanza herbal, that long vida I use.
Yeah.
Long vida and pomela is from prostate cancer. Okay.
Yeah. So I
for
think
prostate cancer. Long vida is this thing. Long vida is curcumin, a special curcumin. This we have tried in Tata Hospital. Is curcumin, and pomela is from pomegranate. So again, these are the specialized formulation. And ashwagandha, I use Ashwa Max, but it is little costly. 60 capsules will cost you around 3,000. But it contains methaferrin A around 3.5% something, or 4%, which is a very good this thing. So these are all from Parmanza herbals. Parmanza herbals. And if you want to use plain but better ashwagandha, you can also use this thing, this Pilcraft, this thing, long Nucleoplus and Immunis Plus of Pilcraft. So that is good for immunity and also contains curcumin.
So, Rajan, which form is more effective, the cannabis, the water extract or oil extract or powder form?
Oil extract, sir. Oil extract. CBD is always in a oil extract and it is based in the MCT oil. It is also prepared in the MCT oil.
LCT oil mean?
MCT, medium chain triglyceride. MCT.
Oh, MCT oil. Okay.
MCT. So it is curcumin, the cannabis extract, and it is made in this MCT oil. But I have typed and how it is not seen.
No, sir, we can see it. Dr. Rishabh Singh, Dr. Preeti Vangala, we can see it here. Dr. Ravi Dalia.
Okay.
Yeah.
But some patients are saying that some people are saying they are not able to see my typing. Anyway.
I don't know, sir. We see it here. I can see. I don't know.
Okay.
Yeah. Sir,
Yeah.
your contact number has been requested. So if you could let us know your phone policy usage and the way people enthusiastically can contact you. So that it becomes easy for everyone. Or your website or your email address, whatever you think is best way to contact you. It is there.
Email is good. Yeah.
Yeah. It is there 98197022151.
Yeah.
And drnitinkochar@gmail.com.
And my website is myayurvedadoctor.com. It may show that the website is spurious or something, but you can definitely bank upon it and you can log in into it. No issue.
Absolutely, sir. Absolutely.
Yeah.
So coming to the fasting, which is again, we have the practice of Ekadashi fasting in our culture.
Yes, sir.
So how do you advise that? That's another set of questions that had come.
Fasting, so the Nobel Prize winner, that doctor, he said ki if you fast once in a week, it can keep many diseases away because your autophagy system is improved. That's what he has proven. So what in Indian tradition is that, do fasting on these certain days, Ekadashi, Chaturdashi, Chaturthi, Navratri, or even the Rosa fasting, they are all meant, they improve the healthy microbiota in the gut. That is the most important thing. So second thing, it improves the autophagy and also what we call mitophagy. Even dysfunctional mitochondria, they have to be taken care. Now, one person has asked me the question, if the mitochondrial transplant is done, whether it will not get affected. Yes, it will get affected if you don't change your diet and everything. So everything goes in totality, right? What Dr. Marwa sir used to tell me, that everything has to be in a totality. Just taking curcumin, ashwagandha will not confer you that you are healthy. You have to have health in totality. Health is a package. So follow the diet, follow the exercise regime, everything. Tadamrustam. Panchadriya, what you are trying to grahan, that you have to, be careful about it. So if you do that, yes, then definitely mitochondria will not get affected. But doing mitochondrial transplantation can give a great boost to improve the chemotherapy effect, to prevent the metastasis and the health of the patient.
Absolutely, sir. I think it would be simply medically imprudent to believe that now we have very Josh-Horsey, the cancer vaccine. Maybe it is great, maybe it is not. But if you don't follow the tenets of healthy living, how much will a cancer vaccine help you is a matter of debate, or is it a pharma lobby trying to push across the agenda of, I don't know, whatever it is behind the scene things. God only knows better, perhaps. Yes. CBD long form.
So cannabis means the bhang, cannabis indica and cannabis sativa. This is the Latin name. So it contains hundreds of cannabinoids. These are the active ingredients, cannabinoids. So of these cannabinoids, there are certain cannabinoids are very essential and important and studied. Cannabidiol, that is CBD. Tetrahydrocannabinol, that is THC. Then CBG and CBN. So in USA or in the European countries, you get
the plant which will produce only CBN and CBG. They culture the plant in such a way and they grow that the plant will produce only CBN. The THC content is higher in Indian cannabis because it is grown in some endangered environment, and in order to protect plant produces some toxin that is called tetrahydrocannabinol, which acts on the CB1 receptor mainly in the brain, and it is psychoactive. CB2, the CBD, cannabidiol, it actually acts on the CB2 receptor, which are there on your immunity. And actually, CBD blocks THC effect. So it's a complicated way to explain. But then CBD will improve your immunity. CBD through other receptors like transient receptor potential of vanilloid, TRP, GPR55. So through all these other receptors, CBD improves the immunity, and CBD kills the CBD reduces the inflammation, and CBD kills the cancer cells by producing ceramide. CBN, CBG, they are very useful for inducing the sleep and also for the pain. So they are available in the US market. If you can have some contact, you can get Green Road Company is a good company which produces CBN, CBG. So they are good. You can try, but they are very costly. Means I'm using it for a few patients, but they are very costly.
Yes, sir. But ultimately, when it comes to life, perhaps there is no price enough to be paid.
Yeah,
So
those who can afford, I'm giving
yeah.
them. You are absolutely right. Those who are affording, I give them.
Now, we do find many times people prioritize more money to shopping and big brands of car as opposed to their own health. So I think quality has a price, and no, I don't want to sound shallow for poor economic people. So there is a connection mentioned here, the spiritual energy. I mean, it's a bit very special topic. If anything you would to comment, most welcome. Dr. Shamala Prasad, has spiritual energy in cancer therapy explored? I mean, non-obligatory, sir. If you wish, you can comment, or else we move forward.
No, spiritual, yeah, Atmik one, what is written in Ayurveda, health is Naro hi tahara vihara sevi hi. Samikshakani Vishayeshu Asaktah Dataha Sama Kshamavana Aptopa Sevicha Bhavati Aroga. So if you are doing seva of Apta people, if you are Vishaya Kamakru Lobhasi or Asakta, and if you are doing daily meditation, it improves your good hormones, your immune system, your immune cells are also stimulated by good amount of meditation. And the feeling of well-being is definitely, important. And that's why even in Tata Hospital, there are a lot of spiritual healers are coming, they are counseling patients. They make them to accept the fact if the person is going to die, yes, he has to die. But then, they make them to accept the fact. So the exit journey becomes peaceful. There are many aspects of the spiritual treatment in cancer.
Dr. Rahul, we have a quick information from one of our enthusiastic participants, Dr. Anasuya from Kerala, rather now Karnataka. She has mentioned a very important point. Maybe the chat typed by Nitin sir is coming to host and panelist only. Maybe that is the reason we have that kind of feedback. So can you kindly, I've taken screenshot, I can share with you, share those typings screenshot into the chat. Then that's easy, Dr. Rahul,
Yes, sir. Definitely.
That will justify the presence. Dr. Anastasia, thank you very much for intervening. That helps a lot. So that if you can just make a screenshot, so that should include sir's typings, which I'll just point out because that is the crux of the entire presentation here. Without that, we would leave them absolutely in a disadvantaged situation. No wonder. Dr. Gary Dehel from Himachal, Dr. Bharti, respected doctors, thank you very much for pointing it out. I think it has come to host and panelists. Dr. Rahul, I am prolonging this because it's our moral duty to ensure that it's happening. So I think you will have to take a screenshot from, one second, Trilokya. Yeah, I think sir had typed at 1250. Let us take from Trilokya, Vichayavati and TV 750 of Pillcraft Company, 60 mg per day of CBD only, THC not more than 2 to 5 milligram per day. Apparently, of course, that is a stronger one. Mr. Bhushan, 9167309474. respected doctors, I hope this would have got into your noting down this if you are. And then Dr. Rahul, it is 1254. Farmanza herbal longvida is curcumin, and pomela is from pomegranate for prostate cancer. And Ashwa Max Farmaza herbals, 60 capsules costing 3,000 rupees. The best possible, no, intense. I think yes, Pillcraft Nucleo Plus and Immunis Plus of Pillcraft. Dr. Rahul, I hope you got those areas as a screenshot, and maybe
Yes, sir. Yes, sir.
yeah, and then maybe this helps everyone very much. Let me see if it has come across. Yeah. Actually, Nitin sir took the trouble of. Now it's for everyone, I suppose. I hope everyone. Nobody has to acknowledge it. It's just fine so that we don't overcrowd the chat box. It's fair enough that those who have seen, they have seen, and we'll be in a position to share with everyone. Yes, sir. Sir, about the Ashwa Max, also the same, you would recommend the same person, Mr. Bhushan, to be contacted? It's a different person.
No. Yeah, you can contact him, no issue.
Yeah.
Or there is another, I don't have his number at present, but you can contact him, no issue.
Yeah. I mean, yeah. Because ultimately, that is handing over the most precise information. Then it becomes easier. I hope, Dr.
And
Rahul,
for
we have
long,
taken care of this 265 participants in spite of 1 o'clock, and sir also has stretched himself for us.
9, 7, 6, 9, 4, 8, 6, 9, 9, 8. For Longvida and Pomela, Mr. Allen. Yeah.
Yes, sir. Then it is all perfect. So that will be the Ashwamax also, no, sir? Most likely.
Yeah, Ashwamax also he will help you.
Yeah.
Farmanzar.
Yeah. That is fine, sir. So long as we have somebody as a lead, it's all
Yes.
easy. Sir, the last question, at least from this side.
Yeah.
It's about I'm sure that's quite popular in Gujarat, Dhatu Bal, as no, Rasbal, Raktabal, that. Dr. Ajay Kumar Yadav, respected sir, please explain target medicine for each Dhatu Gat Am Pachan. So I know it's very popular in north of India, not much in Kerala. The Pancha Kashaya that we have in the Jora context, and we know A for Ayurveda company in Gujarat. The brainchild of that is from actually Dr. Tapan Vaidya sir. The Rasabal, Raktabal, that protocol, Tapan sir would always advise 5 tablets into 3 times a day, like 15 into 5 days, into 7 dhatus, so 35 days. So this, of course, we are aware of, thanks to Vaidya Tapan sir. But anyway, please add on if you feel like, or if you have.
No, sir, I don't use this Rasapachak, Raktapachak. I had used in the past, but somehow I failed to, use it properly. So I don't use it. Second thing, what happens, in a cancer, patients are on so many medicines. So I try to give minimum medicine. So I don't give more than 1 or 2 medicines or max 3 medicines. That also 1 capsule twice a day and CBD like that. If I want to add 4th one, it becomes a task for me. Many patients are senior citizens, they don't remember. The administration is very essential. Drug interaction, you have to be very careful. So, that's why I use minimum medicine.
Yes, sir. Yeah, that helps them to, of course, synchronize to the normal life very effectively. Many times what happens is, I've seen prescriptions, I'm intending no offense, every doctor wants to do the best, about 20, 25 medicines when they go to some Vaidyas, and then there's no need of having food. I mean, the medicines are enough to keep you, keep hunger away, but that is a situation where we don't know if that itself is getting properly digested or not. Maybe more trouble arises from the indigestion of the medicine itself, as opposed to the disease itself, when we know the Agni is the central theme to be taken care of. I was about to communicate that as a feeding up. I remember Dr. C.P. Matthews, sir, who was using for 37 years the integrative option of cancer. In his every cancer patient, invariably, he would have ashwagandha first with turmeric. I mean, after ashwagandha and turmeric, only the next medicine comes. that was so precise. So it is definitely very elating to see that you have brought in those facts so explicitly and so easily available. And this makes it very easy. The beauty or the greatness of your presentation, I'm nobody to validate your presentation. Nevertheless, humbly, I would say is that you made it so simple and so public and so practical that you have nothing of a special medicine of your own, which many famous Vaidyas have. You have whatever it is like public material, anyone can get into. You gave the concept very clearly, again, retaught us, if I use that word. You gave the material very clearly, which medicine to
Sir,
be used.
I use Sitopaladi. I use Sitopaladi for Agni Vardhan. Those who cannot tolerate Pippali, use them Sitopaladi. Sitopaladi, one of the main ingredients, or even to the matter of fact, I have used your Alarkhand.
Yeah.
You know, that I have used I'm using it for my allergic urticaria patient.
Yeah.
So Agni, I use it according to Yukti.
Absolutely.
You may not have proposed it for the cancer, but I use it Alarkhand for the cancer. Yeah. That is Yukti because it contains Nagara and Shira and it improves the Agni. That's it.
Yeah, yeah.
Very simple.
Yeah. Dr. Atreya Sharma had question. I think we'll conclude with that. Have you observed any Dhatu Agni specific Agni Vartaka Aushadhis in your practice, sir? This is a question from
Swarnamalini Vasanta may help.
Yeah. Okay. So, Dr. Sharma, I hope you got your answer. So, in terms of fasting, there's another question that came up. So, which way you would recommend that fasting once a week? Of course, the bala is important, the amount of multiple factors, but still a general pattern.
So, general pattern, most of the patients, I ask them to finish their dinner by 6:30 or 7 p.m.
Yeah.
So, probably absolutely no non-veg after 7 p.m. At 7 p.m. they have to finish. So many patients, those who are diabetic, and suppose those who are on some kind of steroid, they feel hungry. So I ask them to have some other, like, if there is a gap of 3-4 hours, take a cow's milk. Sometimes I ask them to take a papaya in the night. Generally, we avoid fruits at night, but very hungry, then these are the healthy way instead of eating all other bad food. Okay. And once in a week, so you have to cultivate the, suppose if you want to give fasting and the patient is going for the chemotherapy, on day before, on 2 days before, you just keep that patient on your chawal moong ka khichdi. That is the most ideal way. You give buttermilk. Buttermilk is an excellent animal protein. You can give cow's milk with the curcumin and chawal moong ka khichdi. That is the best way you have to give. Now, there are multiple myeloma patients to whom I gave fasting. She was bone marrow transplant failure. So, 1 day fasting. And second day, I gave her ketogenic diet. Means I asked her to eat a vati full of loni, a homemade butter. Of course, her Agni was good. So 1 day total fasting, only water, nothing else. And next day, I gave her, it may not be right, but then she responded well. A full vati of loni, butter, homemade butter, and chawal moong ka khichdi, but no roti, nothing. So that was like a sort of high ketogenic diet, a sort of ketogenic diet. And she followed it for almost 3 years. And she is much better. 1 day full fasting, second day only butter, homemade butter and chawal moong ka khichdi. That's it. So like this, I follow various kind of protocols of the diet.
Yes, sir. Ultimately, we end up incorporating all the principles of Jwara till Vatvyadi. This is as simple as that. Ultimately, we don't have to think cancer separate entity. I think if we can learn from that basic principles and take all the Nidan from Jwar to the Vatvyadi, pretty much we will end up treating cancer anyway. So I hope this webinar helps our recording session viewers who will be watching it later. 444 enthusiastic doctors were here. At the same time, the small Telegram group of mine, I had already kept on sharing your screenshots. Dr. Rahul, I think we can call it a day. It's already 1:13. Sir has already extended 30 minutes more than he promised. I think, Dr. Amran, sir, with your comments, we will conclude.
Good afternoon, doctor.
Good afternoon, sir.
It's a very informative, very useful.
Thank
We
you,
are enjoying last 2.5 hours your new information regarding the how to treat, especially we are facing the main problem nowadays. All are afraid. It is not possible to treat in Ayurveda in the cancer. That approach you are changing now. That is your full confidence with the record and with your experience. First, thank you for that your mother also you bring together and you asking to the mother the question. They're really wonderful. So that is a conference level, everybody is a developer. Sir, I want one question, sir. We are the main problem to the using the permission of the using the usually we are getting the permission from the government. That is usually some the excise department, they are taking some problem using here in
Cannabis, no?
Yeah, can.
Yeah, but then suppose if the formulation is made as per the Ayush, okay, there is no issue.
So we can apply directly, there is no problem.
Yeah. You have to keep meticulous data of whatever you are using, to whom you are using. So I have a full data of my 1500 plus patients, plus cancer patients, every data I have.
No, that is a preparation side, is any problem?
No, I'm not preparing it. So the company from whom I'm procuring, they have Ayush license. It is the cannabis preparation, it has got Ayush license. They can make it. No issue.
Okay, sir. Thank you.
Yeah.
Welcome
Thank
to
you, sir.
Kerala, sir. If possible, please
Yes,
come
sure.
with your family.
Yes, sir.
Enjoy
God's own country. Yes, sir.
Very good, very
Thanks
good
a lot.
conference. Very effective class, very informative. Thank you very much.
Thanks to Sitaram Ayurveda for giving me an opportunity to interact with 400 plus all renowned doctors and students. Thank you very much.
So all the credit go to our son Srijit sir. He is doing all the wonderful job.
Dr. Rahul. Yeah. Thank you very much, sir.
Credit goes to Dr. Hema for connecting the bridge between North and South. I would leave the whole thankfulness to Dr. Hema. She is a great friend and a great doctor herself. And we are eagerly waiting Dr. Gara sir to bless us on 30th of October. So anyway, we will all have the information conveyed. Thank you. Jai Hind.
Yes.
Jai Hind.
Thank you. Jai Hind, sir. Jai Hind. Bye-bye.